Hey guys, so I hope you guys can hear me really good. Today I want to talk to you guys about waking up during surgery. Is it scary? Is it your biggest fear? So let's get into that. I'm gonna wait for a couple people to join the live. Hey guys, I see you all joining. Hey Trim McCoy. So I want to talk to you guys today about waking up during surgery. I'm pretty sure you guys saw that as the title to the video. And of course, at the end, we can do some Q&A, and you guys can use the question box at the bottom to leave your questions so I can answer them. Hey Spanish doll. I see you guys. So I know for me, my biggest fear was waking up during surgery. You see all kind of crazy stuff on the internet and the news. People talking about they were paralyzed during surgery and they felt the pain, they felt the cutting, but they couldn't scream, they couldn't say anything, you know. And when I hear stories like that, that for me was my biggest fear, probably besides dying. That was my biggest fear going into plastic surgery. Is like, oh my God, excuse me, what is going to happen if I wake up during surgery? Am I going to feel anything at all, or feel everything, or is it going to hurt? Because believe it or not, even though I've had multiple rounds of plastic surgery, I do not like needles. I am a big baby when it comes to excuse me guys, I have a little frog in my throat. I'm a big baby when it comes to pain and needles. Like, I can't even stick myself with a needle if I had to save my life. My husband is the one that has to do it for me. So let's start with my round one, my experience with waking up during surgery, and then I'll go into round two, because round two is even more hilarious. So be sure and stay tuned in to listen to round two, and then we're gonna go into question and answers. So round one, it started off with so in SIPLA, when you have surgery in SIPLA, you are assigned your overnight room, and that's where, you know, you're gonna go put all your belongings and change into the hospital gown. Your doctor is gonna come mark you up. The anesthesiologist is gonna come talk to you, ask you if you have allergies, things like that. So one of the assistants, I guess, came into the room and gave me the blue pill. So we were talking about the blue pill on my feed and on my IG stories over the last 2 days, right? I got the blue pill. All I remember is I took the blue pill, and then the next thing was I woke up during surgery. So my husband, my best friend, they took a video of me after I took the blue pill. And it was so hilarious. It's there on my feed. If not, I'll repost it again for you guys to see, where they were talking to me and I was answering them. And I don't remember any of that. Any of that. So the blue pill, what it does is it takes away your memory, and it puts you to sleep. So it relaxes you. It's a sedative. You don't remember, like I said, after you take the blue pill, certain parts after that you don't remember at all. So about 15 minutes, I think they said it took for me to fall asleep. Then the assistant came, put me in the wheelchair, wheeled me up to the operating room. I don't remember any of that. The next memory I have is I felt a little pinch, like an ant bite you. So it was a little pinch I felt on my back. So now that I know about surgery, I know that that little pinch that I felt was the epidural when they were giving it to me. So in the room, they give you the epidural, they give you a catheter, and they put the IV, you know, on your wrist here. None of that I remember for round one. The next memory I have is during surgery, I didn't feel pain, but I felt pressure, if that makes sense. So one of the videos I have showing my actual round one surgery, you would see in it that Dr. Lauren is, you know, using the cannula and lipo in my back. So that movement like that, that's what I was feeling, but it's not pain. It was just like pressure. In that video, I think I moved my arms a little bit, and then from there, the next thing I remember is I woke up at the very end of my surgery, and and I was like, ow, ow, and then I'm like repeating this. Why am I awake? Why am I awake? I keep saying that over and over. So Dr. Laurent came up to my head because they have a sheet, you know, from here down, you can't see your body. And he said to me, he's like, you're okay, you know, you're fine, everything is okay. And I'm still going, ow, ow. So that's when I realized now that when Dr. Laurent is at my head talking to me, telling me I'm okay, it's because his assistant, you guys all know, everybody uses assistants in the operating room. One doctor can't move your body and do everything himself. Was the one actually doing my tummy tuck incision. So if you guys are new followers, you have not heard me, you know, talk about this before. I don't like my tummy tuck incision, how it healed. It's not a nice little thin line. When the incision was done, it was, you know, jaggedy like that. So that's one of the things that I want to get redone, is my tummy tuck incision redone to look like a nicer, prettier scar. So that's how I knew it was the assistant, because I'm feeling the needle going into my skin as they're stitching me up. So at that point, the anesthesiologist, who's in the room with you not 24/7, but for the entire operation, the anesthesiologist is in there. He gave me whatever cocktail of drugs they give you. I went back to sleep. Now when I was about to get wheeled out of the operating room, so my surgery is over, I woke up again. And Dr. Laurent is like this, holding up the two pieces of the fupa, belly fat area that they cut off, holding it up and showing me, look, Roberta, this is what I cut out of you. And I'm of course groggy, and I'm like, okay. So then they take you into a room that they have other dolls in there in Cipla to monitor your blood pressure and stuff like that, your heart rate, before they take you down into your overnight room. So that's round one. My experience waking up during surgery, how I felt, what I experienced. And round two now, totally different animal. Oh my God. You guys are gonna die laughing when you hear about round two. So round two, we're in the room again, the overnight room, because I had my both surgeries in Cipla. And they give me the blue pill. And in about 5 minutes, the guy with the wheelchair come to take me to the operating room, and I am wide awake. Like, this blue pill is not doing anything to me. I am not feeling drowsy, didn't fall asleep on myself, nothing. I am wide awake. Okay, so in Cipla, the operating rooms are on the 3rd floor, and the 4th floor is the overnight rooms. So he take me in the wheelchair, I'm wide awake, I'm very coherent, I'm very aware of everything. Put me in the elevator, we go down to the 3rd floor. I got out of the wheelchair, I'm in the operating room now. In the operating room, Dr. Laurent is not there as yet, but there's about maybe 4 or 5 people in there. There's the anesthesiologist, Dr. Laurent's assistant, other people that are assisting in the surgery that is in the room. So I get out the wheelchair, they tell me sit on the stainless steel operating table, right? I sit on there, and I'm so freaking nervous. I'm so nervous, I'm so anxious. I get the bubble guts. Guys, I had to take a poop. Kid you not. Now, I know I tell you guys all the time, a lot of these people that work in these clinics and hospitals, the nurses especially that work for the actual clinic, do not speak English. So I tell them, I'm like, I gotta go poop. And they're like, I think I said El Baño. And they were like, no, it's okay, because you know you're gonna get the catheter. So I'm thinking that they're thinking I wanna pee. So I'm like, no, and I had to say in Spanish, I'm like, no, caca. So that's when they were like, oh, okay. So I get off the operating table. One of the ladies in the room, she hold my hand. She's holding my hand, and she has her hand on my shoulders. I guess she thinks that the blue pill is gonna kick in, and I'm just gonna fall on the floor and fall asleep, right? So she's holding me, guiding me. We leave the operating room. We go next door to another room. The lights were off. It was pitch black. And then there was a bathroom in that room. So I took a poop, wiped, washed my hands, came out. She's holding me again. We come back into the operating room. Now, mind you, I took a poop that morning before I even came to Cipla, right? Because remember, you're not supposed to eat the night before, like a freaking 9 o'clock or whatever. So that was 2 poops I took that morning. I was so damn nervous. So they put me back to sit on the operating room. I mean, on the operating table. And then the anesthesiologist comes and the assistant comes and is holding me. He's holding me up. He has his arms around my shoulders. The anesthesiologist comes and he gives me the IV in my wrist. Now, you guys know this is a painful area here to get that needle. And the DR, I swear they use like big ass needles. So I was like, ow, 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 as he's sticking the needle in my wrist, you know, to put the IV in, to tape it down, whatever. And then he gives me something in there to start relaxing me. So the blue pill, I think, is not what really kicked in. I think it's whatever he gave me to start relaxing me. The assistant is still holding me in a sitting position and holding my shoulders. After that, I guess that's when I started feeling like drowsy, like I was about to fall asleep. And they gave me the first epidural. I got 2 epidurals because I was doing breast this time during surgery, right? So the first one, they gave me like my lower back. I really did not feel pain of any kind. What I did feel was my legs and my toes went numb. That is the craziest feeling, to feel that between sleep and wake. And then I said and I remember in my mind telling myself, move your foot, move your foot. It was numb, guys. Could not move my toes, could not feel my legs at all. And then they gave me the second epidural, which is for that upper breast area, part of the body, and then I was asleep. So now I'm asleep. Surgery has started. The first thing I remember is during my surgery, waking up and telling, because I asked Dr. Lawrence's assistant, Jenny, if she would come into the operating room and record some of my surgery for me. So she had my phone, she recorded, I think, part of my breast surgery and stuff. Part of it I was talking, I don't even remember this part, where I was talking to them. You see my eyes open, all of that. I remember, let me see, which part was this? I woke up and my neck was hurting because, you know, they have you lying down flat on this stainless steel table. And I was like, Jenny, Jenny. And she came over and I'm like, excuse me. She came over and was like, and I'm telling her, and I'm like, I need a pillow. My neck is hurting. I need a pillow. Fell back asleep. The next time I woke up, I had a pillow, a little square rectangle, like pillow from your couch, under my head. I don't know where they got that from. Then I woke up again, and I felt like I couldn't breathe, and I was moving my head like this because the sheet that they have up to your neck was kind of covering my face, and that was feeling weird. And then the oxygen tube that they have in your nostrils, that was giving me like congestion. So I'm moving my head like that to like take the sheet off my face, and then I'm telling them I can't breathe. So the anesthesiologist, I think it was him, pulled the tube out my nose, and then they put some like aspirin or decongestion drops in my nose, and I started breathing again. They put the oxygen tube back in my nose, went back to sleep. I woke up a lot during the surgery. The next time I woke up again, they were working on my breasts for my breast reduction, because I remember smelling, because you know they use the tools that they use, it's like a, not laser, but it's hot, it's heated, and that they use that to cauterize your blood vessels so you don't bleed a lot when they're cutting, right? So I smelled that burning flesh smell. Guys, don't be grossed out. I swear it smelled like barbecue. Like seriously, I really swear it smelled like barbecue. So I woke up for that. Didn't feel any pain at all. Just smelled that. Went back to sleep. And then I'm not sure. I don't remember if I woke up another time again and said anything to them. But yeah, that was my experience. Waking up during surgery, no pain at all. Just like I said, you know, you're gonna remember some of the things that, you know, you talk about, that they ask you questions or they tell you anything like that. You'll remember that during surgery. Like you don't get, I don't know, amnesia or whatever, you know. So that was my experience. It was way worse than I thought it was gonna be. It really was not scary, you know. I really thought that I was gonna be like freaked out, acting crazy, whatever. None of that. I mean, I'm gonna be having surgery again soon, you know. So you guys are in the comments asking if it's like a C-section. I don't know. I don't have children. I never had a C-section. It smells like burning skin. I'm an L&D nurse. It smelled like barbecue. I swear to you all. That's how I felt, you know. So that was my experience, guys. It was not bad. It was not scary. It was not anything. It was good. Even though I have, you know, no matter how many surgeries I have or will have, I'm always nervous. I'm always anxious. I hate needles. You know, my hubby is the one that has to do anything with needles for me. I swear if I had to poke myself, I would probably faint. Like, I had to, because after the, what do you call it, the blood thinner shots, Dr. Lauren told us to save one blood thinner shot, one heparin shot, and take it 1 hour before our flight departs when we're leaving the DR. So the first round, my husband and I, we both had our blood thinner shots. He said, okay, we'll do it, go into the bathroom and do it. Guys, my husband went to the bathroom, gave himself the blood thinner shot in his leg. I'm there in the women's bathroom like this with the needle hovering above my leg. I could not do it. I didn't do it. I threw it away. I could not do it. Like, I hate needles. So round 2, Elaine, my nurse, she gave me the shot in my arm, and my hubby as well, like right there in the food court area before we left to go on the plane, you know. So so it really wasn't a bad experience for you guys that are scared, worried, anxious, nervous. It really wasn't. There was no pain involved, so I'm okay with waking up as long as I don't feel pain, you know. Do you think the anxiety that makes you wake up during surgery? No. So I asked the anesthesiologist why it is that I woke up during surgery, especially for my round 1 at the very end of surgery, and he said that they don't like to over medicate you, and they try to give you enough medicine to keep you awake for the length of the procedure based on your height and weight and so forth. And that's the reason why you woke up, because, you know, it kind of ran out at the end. But that's why they have the IV in, so they can give you whatever it is they need to give you to put you back to sleep. Now, in regards to what exact name of the medications they give you, that I don't know. I never really asked anybody, well, what is the, you know, blue pill name in the DR, or what is in the IV bag. Like, I've never really asked them exactly what it is, because I mean, I trust their judgment, you know, in that sense. So I'm not anything in the medical field to say I can tell people, well, I know, oh yeah, I heard that name before, I know what it is. No, I don't. Did your husband have surgery? Yes, my husband has had 2 rounds of surgery. He's had 2 rounds of lipo. The first round, Dr. Lauren decided, he's going to do 360 lipo with an ab etching on my husband. Guys, don't do no ab etching with these doctors in the DR, because my hubby ab etching came out horrible. Dr. Lauren, I love you, Dr. Lauren, but you are not skilled when it comes to ab etching. I don't know for the life of me why the hell my husband has like 6 to 8 puncture wounds all over his abdomen, and my husband keloids really bad. So all of them are keloids, where Dr. Lauren tried to do this ab etching on him. So round 2, and because he keloids, you guys that keloid easily, that means that scar tissue forms very easy in your body, which means that you are more susceptible to getting fibrosis. So my hubby, even though we did a shitload of massages, you know, to each other after surgery, for months after surgery, he still had some keloid areas around his belly button area. So round 2, we go back to Dr. Lauren for another round of 360 lipo for him to get rid of that fibrosis and some fat that Dr. Lauren did not take out, like close to what you would call the love handle area and his upper back. Guys, he did not even touch, he didn't attempt, he didn't do anything to correct my hubby's fibrosis or the fat that remained back on his body. To be very honest with you, we really don't know what exactly he did to him, because when my husband was doing massages, he was like, I'm not even in pain, it's not even hurting. And when you have lipo, anybody that have lipo will tell you that hurts like a mother. So you know you had lipo because your skin is very, very painful. So if John is massaging him and he's like, my back is not even hurting, That tells me like, well, what did you do to my husband? You know, you didn't. He still looks the same. He really doesn't look any different. Coming to see you and spending all this money for round 2. So he's gonna do a round 3 because he still has that fibrosis that needs correcting. And he's gonna be doing vasa lipo to get that correction done. So really and truly, when you have fibrosis, vasa lipo is really the only measure really that corrects fibrosis. Traditional lipo really, unless the doctor is really skilled at fibrosis correction, you know. So that's how I felt when I had to do my own heparin shots. I had to close my eyes every time. Girl, more power to you. I can't do that shit. I'm too much of a big baby. What was your beginning weight and height? I'm 5'4". My round 1 I was at 35 BMI. Round 2 I was at 33 BMI. Right now I'm like at 33, 34 if I gain a little weight BMI. They call it the happy cocktail here in California. You are assuming right. I will not be going back to that man to give him my money. No. Burn me once and you don't have to burn me a second time. I'm good with learning my lesson once. Them massages was not a good time. Nope. I am not looking forward to lymphatic massages after lipo. But you know, I'm not even gonna pretend to you all. When I get my massages, I'm pretty sure the neighbors be wondering what the hell is going on in that condo Airbnb, because I be cussing. Like John be massaging me and I be like legoing F-bombs left and right. I be like, John, give me 30 seconds. Like stop. Let me catch my breath for a minute. Like, but you guys know for yourself, you can see for yourself John methods work. You know what I'm saying? So I can't even be mad at him or fault him. Like, he know what he's doing. But there is no shortcut around that. It hurts like a motherfucker. I'll be the first to tell you all, nobody warned me or told me that lipo massages and lipo was gonna hurt so much. It's the devil. That's what I call it. It really hurts a lot. 10 out of 10 for sure. Renee said, I didn't even notice my tummy tuck. That lipo hurts so bad. You know, that's true, right? The tummy tuck, really and truly, that whole area, your fupa area, is numb. So when they stick the needle in you to drain your fupa area, you don't even feel it. When they pull the what do you call it? Pull the drain out, I didn't feel nothing. Guys, y'all who in Atlanta, why the F y'all always have all this blasted traffic? Oh my God, what time is it? 9:30 at night, and it's a parking lot on I-75. Atlanta, you all gotta do better with your roads, man. What the hell? No amount of painkillers can help. Well, I don't know, because I didn't take any painkillers for my surgery. I didn't take anything strong. So I don't know if you guys that do take strong perks or Vicodin or whatever, like how Oxycontin, whatever, if that helps if you take it before your massages. I'm going in June to prepare myself mentally. Is it true to take painkillers prior to the first massages? Well, that's what I just said. I really don't know if that helps, because I did not take any painkillers. And do the doctors send you home with painkillers? No, they surely don't in the DR. They do not give you any kind of Schedule 1 drugs. So how long do they take the drain out? After tummy tuck, usually, what do you call it? About 2 weeks, most people. Okay, it's All-Star Weekend. Okay, I'm not hip with the culture, so I don't even know what the ass that is. I slept so good after John's massages. What are you looking to get done in round 3? And you look amazing, by the way. Also, what are your top doctors you're considering for round 3? Thank you. It's just drinking water, minding my business. I'm allergic to painkillers. Atlanta is going to be horrible because it's All-Star Weekend. Oh my God. Thanks, guys. Now I know there's someone stank ass I-75. And it's Saturday, so I could imagine people are partying all over. So let me give you guys my wish list for round 3. I'm pretty sure I'm not gonna get all of this done. I'm gonna have to come back for round 4 because it's too much surgeries. So starting from the head, go down. I want to get dimples. I've always wanted to get dimples. right there. I want to get some J plasma for my neck under here, because I feel as I'm getting older, you know, the skin is getting thinner. Then I want to get my breasts reduced more, because of course, again, I feel like Dr. Laurent, my whole round 2, I need to redo my entire round 2, which was 360 lipo BBL and a breast lift and reduction. So I want to get my breasts reduced again, because I was a triple D. He brought me down to a D, and with the weight gain that I have, it's now a double D. When we had surgery, I specifically discussed with him, I want to go from a triple D, I want to go down to like a BC, like a small breast. Nope, he did what he wanted. So I want to get them reduced again, and I might be getting implants. I'm not sure as yet if I will, but I may be getting implants for the perkiness. That's what I want. Then of course they got to do 360 lipo to get some fat, right? So whatever little fat they can find on my torso, because I really don't have a lot of fat on my torso, 360 lipo. My arms, I want to do lipo, but I do not want to do the arm lift. I just want to do like a mini lift, where after they lipo it, they tuck the skin, the loose skin, they cut and they tuck and they stitch under your armpit. So hopefully my lymph nodes are not jacked up because of that. And then my butt, I have some little bit of fat that I need injected on the sides of my hips. Not hips, my thighs. Where my thighs and where the butt cheek and the leg meet on the sides, fat was absorbed there after my round 2. So I want to get some fat put there to fill it up, fill it back out. It's not a big like dimple hole, whatever, it's small, but still, you know, I don't like how it looks, so I want to get that done. And that's it. Oh well, sorry, I want to get my tummy tuck scar redone, but I don't know if they'll do that. And then I have a little bit of loose skin on my waist that never retracted after all these years from lipo. It's a little bit, it's not a lot. I know most people will be like, ah, that's nothing, but I would like to get that cut out as well. So I don't know if when I'm getting the tummy tuck scar redone, if they'll just take the scar all the way around to the back and cut it and do that. So I'm not really a big fan of the scar, so we'll see, but that's my wish list, and we'll see how much of it I actually get done. Let me see what else you guys are asking. And I'm gonna come to the question box, guys. Please go to the question box and ask your questions. It's an NBA thing. Oh, I don't even watch sports, so I don't even know. John's IG is J_masajes. Masajes is like the Spanish word for massages. I didn't know you can do J plasma in the neck and chin area. Yes, any way that they do lipo, they can do J plasma, because the way that J plasma rod looks like the cannula with a little red light on the tip, when they make the incision and the hole to stick the cannula, they can do the J plasma cannula wand in the same spot to pass it along those areas to tighten the skin. But guys, know that J plasma, and I have a video on this on YouTube, J plasma is not permanent. Most people say it lasts about a year or so, and think of it like this: it's like elastic. The more you pull elastic, after a while it's going to stretch out. So when they do J plasma on whatever area of the skin, yes, the skin will tighten up, but after use of that body part, for after however long, it does lose the elasticity again. And which doctors do I have in mind? Yeah, I think Lauren does what he wants, because I asked him to cut out this fatty tumor I had on my knee. Round 1, he didn't cut it out. He stick the cannula in there and lipoed it out. It came back. Round 2, I asked him, can you please cut this out for me? He didn't. I asked him when I saw him after surgery, what happened to my knee? Oh, I forgot. That was his answer. I forgot. So what were you thinking about when you were in the operating room, if not all the different things I asked you to do for me? Which doctor do you prefer in the US? What's that? 0. Scar revision, they cut it off and reattach the skin. It's not super deep. So I'm hoping that the tummy tuck incision that they do lipo and then do that. I don't know if they will or will not. We'll see. I don't know, guys. I'm so in between doctors. There's so many doctors that I do like their work, but that's on paper. You know what I'm saying? That's the prettiest and best results we all see on Instagram and on Facebook and whatever, right? We never see the people that hate their results, didn't like how they look, didn't like how they come out. We always see the best of the best on all these doctors' Instagram and so forth. So for me, I feel like this time I'll be going to the DR probably for 3 weeks to a month this time when I go. And the reason why is because I want to go and see the different doctors that I do like based on their Instagram, and get an in-person consult, see what it is that they say, you know, in regards to what they're gonna do, what they can't do, and I'm always very upfront. You guys know I'm a very upfront person and very direct and very blunt. So I want you to tell me, what should I expect after surgery? How is this gonna heal? What are they thinking it's gonna look like, you know, when they're done with me? So based on that is when I will make my decision. Doctors I like, for example, I have not seen a doctor put up results that does arm lipo like Cabral. Cabral sucks your arm dry. I don't even know what happens with loose skin, because it doesn't seem like his girls, they had big arms. He sucked it dry and they didn't have any loose skin after. So I don't even know what technique he uses to do that. One of my friends went to him in November, Thanksgiving. I met her in the DR, and when I went down there in December, she was still there. And he did arm lipo on her. He did a tummy tuck revision, BBL lipo on her. And her arms now, crazy. So nice and slim. So something that you guys may not know about Cabral is, or you may know, Cabral will do your surgery, because he did her surgery, but he charged her an extra $1,000. He told her, because she told him, I want you to touch me. I want it to be your hands. I want it to be you who is doing the surgery, not your staff, doctors that you hire. And he told her, okay, we can do that, but it would be another $1,000 on top of what your quote is, and I'll book you on a day when I only have like 1 or 2 other people. So there was 2 other people booked, but he only ended up having 1 girl because the other girl didn't come. So she was just the second person for the day with him and had her surgery, and he did a phenomenal job on her, you know. So I mean, you can't take the man credit away from him in regards to how skilled he is as a surgeon. So I love his arm lipo. He is definitely, even though I have doctors that I am working with, he is also one of the doctors I am considering just for those arms. Really and truly is for the arms, because I already know that my torso, I don't have a lot of fat to lipo to say I need shaping up a lot. My butt, I have a lot of fat already in my lats and my hips and my butt cheek. So there's not a lot of work for him to really do. So for me, it's like somebody with the eye for detail is who I'm looking at as well. So Dr. Rami Mejia, who is actually right next to Cabral, he's in suite 506, Cabral is in 505. So that's one of the doctors I'm working with. I am loving his lipo as well. Dr. Garrido, what I love about Dr. Garrido, not just his results, like his assistant who he did her surgery, she looks crazy, like bananas. I love her shape of her butt, her torso, how nice and flat, how he lipoed it. But what I like about him is that he is not just a plastic surgeon, he's also a surgeon. So he's what they call double board certified in the DR, because he does regular surgeries and plastic surgeries. Dr. Eusebio, even though his assistant Wendy makes the experience shit, and I will be letting him know that when I see him in person, she really does, she sucks ass. So if you guys have to go to UCBO and deal with Wendy, expect that bullshit. I love his work as well, because I feel like he has a very very minute eye for detail, or attention to detail, when it comes to small things that you want to get perfected on your body. Like some of the stuff I've seen him post with fixing people's dog ears or reshaping their butt, is like, damn, like he really takes his time and does his work. Out of Wendy's own mouth, the day I went to his office, she said, oh, the doctor is doing 3 people today. So I thought he used to do 2, but apparently he does 3 on some days, according to her. So for me, it may be this round that my husband and myself may have two different surgeons. I kind of want it to be the same surgeon, but then comes into play is which doctor is also doing J plasma, because I really want that J plasma for under my chin area. So to find a special combination of I want J plasma, I want Vasa Lipo, who is doing the arm lipo really good that I like, who is has an eye for detail to do small stuff. So for me it's hard because this third round is not like a major transformation for my body. It's just really small little areas that I need work on, so I don't know, guys. I will let you guys know who I eventually go to, but again, for me it has to be, I want to get an in-person consult to hear what everybody has to say. Do doctors tell you how much weight was removed? Weight like what? Like how much your fat weighed that they cut out of your belly and stuff? Mine didn't, so I don't know. You may have to tell them you want that information after surgery so they can, make sure and get that for you. But I don't think that's common practice to just tell you, oh, I took 5 pounds of fat off your belly. Dr. Duran, pretty good, I heard in DR. Yeah, go enjoy that burn. And go enjoy getting treated like piece of shit from her and her bestie, Disla. That's all I gotta say. Enjoy that shit. What made you go back to him for round 2 if he messed up the first time? He didn't mess up the first time. That's why I went back to him for round 2. Round 2 is where he fucked up. Round 1, he was the most attentive, professional, friendly, nice, going above and beyond doctor. And that's why I went back to him for round 2. And round 2 is when it was like, oh, well, I already got her money. I already got her hooked in as a client, so I don't have to give her the time and attention I gave her for round 1. So round 2, there was half the time, like my husband said, we constantly felt rushed because we're in the middle of talking to Dr. Laurent and he's always being interrupted, answering his phone, leaving the office in the middle of conversation to go get coffee, coming back half an hour later. It's like a total 180 of how he treated us for round 1. Marina says you don't pick Duran, she picks you. Yeah, she's that full of shit. Would you ever consider any doctors in Colombia? No. And why? Is because I feel like Colombian surgeons are, I don't know, racist. They practice colorism. I don't know, because the popular doctors in Colombia, because I've never been interested in going to Colombia, so I've never looked into all the unknown doctors of Colombia. But the famous ones in Colombia, like Plaza, the other one, Marcos Pietro, they don't ever post black women or brown women on their pages. They don't ever post women that look like me. All I ever see is white women, skinny women, or white women that look like they're Caucasian or they're light-skinned Spanish. I don't know. So why would I give you my money if you're not proud enough to show me off on your page? Look into Jose Luis for your husband. He works on a lot of men. So does Eusebio. Eusebio is known for working on a lot of male patients. Let's see in the questions. Are you required to lose weight before surgery? It depends on how fat you are. If you are a BMI of 40, yeah, hell yeah. A lot of doctors are now saying 31, 32 is the max that they're going to work on. Some doctors go up to 35. Are heparin shots given for some surgeries? All surgeries, your doctor should be giving you blood thinner shots after your plastic surgery. And that's to help reduce getting blood clots. You are susceptible to blood clots not just a week after surgery or 2 weeks, but up to a month or more after surgery. You could possibly get a blood clot. So that's the point of the heparin. Clexane, Warbutane or something like that is the other name that they have for blood thinner shots. Where did you get your bracelets? I'm looking for one. Ah, you saw them? Girl, if I tell you, you're gonna laugh. I was in Columbus, Ohio, not last year, 2019. I've had this on since 2019. And we have a friend. He is from La Vega in close to Santiago in the DR. and he's there actually right now. That's who we were hanging a lot with in December when I went down there. And he lives in Columbus, Ohio. And we went to a Mexican store to buy some stuff because we were cooking. And they had them selling there at the counter, I think for like $5. And I bought 2 and I put them on because I'm not really like a religious person, like I'm a diehard Christian. I would say more of a spiritual person, where I strongly believe in the energy that you put out into the universe is what comes back to you. So the evil eye, like I love that whole the symbolism behind the evil eye, I should say. So that's why, yep, I've had them on since 2019, and I think they're bringing me good luck. I am booked with Laurent for next month. You make me want to change surgeons now. Who would you recommend for the best BBL with visa? Girl, everybody is the best damn doctor, okay? It really depends on a lot of things. Your foundation, how much the doctor does in the surgery, how good of a procedure he does to you. Because Laurent pulled my abdominal muscles really tight. Really, really tight, and that is what gave me this tiny waist. My waist literally went from a 44-inch waist before surgery to, after all my swelling went down, to a 27-inch waist. Okay, so he did a phenomenal job in making my waist get really nice and small and tiny. But people are complaining and telling me, my friend just went to Laurent not long ago and he left a whole bunch of fat in her upper back, whatever. He didn't do a good job on her like he did on you. Is it his assistants doing the work? Is it him doing the work? I don't know. I don't know what's going on with Laurent anymore, because I don't be asking the man his business. I don't be asking his assistant his business. The last time I spoke to him was when he had that debt. And I asked him, people are saying out there in these damn gossip blogs or pages that you all be following, that you had a debt and this, that, and the other. And he was like, no, the woman didn't die. She's in the ICU still. But it's what? I don't know what was the complication. He didn't tell me what was the complication. And then when she did die, he said that we're waiting on the autopsy report. So we're not going to make any speculations, as no one should, and say what is the reason why she died. And that's the last I spoke to him. I never heard what was the autopsy results. I never reached back out to ask him what the results was. So, if you want to change surgeons, that's on you. You got to know what you look like, your foundation, be realistic, and know if it is you're going to need multiple rounds. The look that I want personally for my body, I love that fake ass Barbie look with that tiny waist and big hips and big butt and small boobs. And yeah, I don't give a fuck who don't like if I look like a plastic Barbie. That's what I like. I'm not doing plastic surgery for the approval of random people who didn't give me $1 towards my surgery. I'm doing it for what I want to look like. So I knew that if I want that fake ass plastic Barbie look, I would need to have multiple rounds. So you got to know that. And like I said, when people talk about who's good with a BBL in the DR, whatever, a lot of these doctors do good ass work. But again, it depends on your foundation. It depends on what you do post-op. Are you feeding the fat, or are you listening to these people, out there and eating all this damn diet food after surgery and then expecting to have a big ass donkey butt? You know what I'm saying? Like a big ass dunk. No, you're not gonna have a big ass dunk if you right out of surgery talking about, I need to eat healthy because I just had surgery and my body needs all this healthy food and whatever. I mean, guys, I understand that some of y'all don't have a clue what it is I'm talking about. And I be assuming that people be knowing what I'm talking about when I say certain stuff. So I'm not telling y'all, to go out there and eat McDonald's every day after you have surgery. No, when I say feed the fat and I say carbs and sugar, and I give examples like white rice, mashed potato, bread, pasta, soda, McDonald's or Wendy's, whatever, French fries, whatever, that doesn't mean you have to eat that every single day for every meal. So I posted on my IG stories, I think 2 days ago, Alpha Recovery in Miami posted a picture of food that she made for one of her clients, and it was some white rice, and then she made like some chicken and vegetables with like a chicken broth. So it kind of looked like a soup with white rice next to it. And she had like a couple crackers on the side of the plate. And I posted that. And I said, this is a perfect example of feeding the fat and still eating healthy. Because you're getting your fresh raw vegetables. You're getting your protein from the chicken, and you're getting your carbs, your white carbs from the white rice and the crackers. And then if you want to eat your quinoa, salmon, avocado, nuts, you can put your avocado on the side of that. So you're still getting healthy macronutrients, but you're still also feeding the fat by eating some carbs. So that is the whole point of feeding the fat, is that you cannot go on a diet and stop eating anything with sugar, anything with white refined sugar, anything with carbs, anything with starchy white carbs. You cannot cut out all of that in your diet. You know what I'm saying? You can't. Y'all gonna say surgery is racist or whatever, but I'm gonna be real with y'all. You see them white people in these surgery pages that have these little athletic, slim, cute little booties, and I'm not gonna call names because you all follow some of these pages. If you all want to look like that, then listen to them kind of people and eat what they're eating with their vegetarian, and they don't eat cheese, and they don't eat white rice. And one girl wrote about white rice makes you constipated. That's a bunch of bullshit. Maybe it makes her constipated. I don't know. But us people who are, whether we're black, Hispanic, Latino, whatever, Caribbean people, white rice is part of our diet. And that has a lot of fiber in it. And it will make you poop. There is no white rice makes you constipated. Okay? So I'm not trying to be racist, but I'm going to be real with you all. If you all want to look like them white girls with them little butt, then eat like them. But if you want a big ass butt like I have, you can't eat that shit 24/7. You can incorporate it into your diet. Yes, eat your salmon to get your what the hell you call it? What they call it? Heart healthy fish oil, whatever the heck they call it. You know what I'm saying? Eat that. Eat your quinoa. Eat your avocado. Eat your nuts, whatever. But at the same time, too, you're eating all of that. Eat some processed sugar. Drink a soda. Drink some orange juice. That has a lot of sugar in orange juice. And it's also good for you. It has vitamin C and whatever else in it. You know what I'm saying? But you need to incorporate carbs and sugar into your diet as well. So a lot of people ask me this. Well, how long should I feed the fat for? Most doctors tell you feed the fat for 60 days. And then after 60 days, especially if you have the tummy tuck, then you can start light workout and so forth, and exercising and whatever. So your muscle repair had time to heal. You didn't try doing no damn crunches and abs and then bust your damn muscle repair and injured yourself, right? They say 60 days for feeding the fat. I will only tell you all what I did. There was no 60 days with me. I still be feeding the fat. Okay? That's why my ass gained 20 pounds. Okay? I still be eating whatever the hell I want. And I guess, because I know it's months before I have surgery again, now I'm just like, whatever, fuck it. I'm just going to eat whatever and let them just get something to lipo out. But realistically, guys, all the weight that I gained, the 20 pounds, I would say 15 of those pounds went right to my hips and my butt. Why? Because that is the area in your body that has the most fat cells or concentration of fat cells. When they lipo your belly or they lipo your chin or your arm, they are removing the fat cells. So there is very little fat cells there to expand and get bigger. Because that's what happens when you feed the fat. It's not that you multiply your fat cells times 1,000. It's the existing fat cells that remain there. They get bigger and bigger and bigger and bigger. That's what the butt fluffing, feeding the fat, the fluff fairy visit you, that's really what it means. It's because the existing fat cells now, so after fat transfer, which is hips, BBL, the existing fat cells that survive, right, they are going to get bigger and bigger and bigger and bigger when you feed the fat. It's not that those fat cells are going to multiply, from 5 fat cells to 20 fat cells. No. It's they're expanding and getting bigger. When you diet, you exercise, you do cardio, you lose weight, those fat cells that were this big, they start shrinking and getting smaller. So that's why you would see that your butt will change shape and size if you start working out hard and going and doing a lot of cardio and stuff like that. So, hey Harry Slim Thick, Lilani, I need to WhatsApp you. So that's really what happens. That's the science behind the BBL. What's happening with the butt? What's happening with when you feed the fat? Why that happens? How it happens? Whatever. So, like I said, I ain't trying to sound like I'm some kind of racist person, but I'm just saying, if you all want Karen butt, then eat like Karen. If you all want big old donkey booty, then you gotta feed that damn fat and eat some non-diet stuff. You know what I'm saying? I want the Vixen look, the same exact look you described. Who would you recommend for that, if not Lauren? Because you're my surgery mentor. You gotta be realistic, where if you don't have no butt, like I had none to start with, and even after the first BBL, a lot of people have to get a second BBL because they don't have that projection, which is the fat survives on the top part of your hip more. The fat in the bottom and the bottom of the butt cheek to squeeze, that for some reason, I don't know why, like I said, you guys who be not laying on your butt for 2 months, who be sleeping like the flamingo, like I said, or doing all that crazy shit, I'm never putting weight on my butt ever. You all still end up with the same shit, which is the body absorb the fat within those first 6 to 8 weeks, and you have to get a second BBL to get that projection in the bottom of the butt cheek. So you may go and get a round 1 BBL with whoever. Go to Cabral, go to Disla, go to Duran, go to the known people that you guys see out there and think that all their patients end up looking like that. No. You know what I'm saying? But when you get that first BBL, if you haven't had much to start with to begin with, you more than likely will have to go back for a second BBL to get that bottom booty projection. Myself included. And if you guys scroll down on my feed, you guys gonna see round 1 how I looked, round 2 after 1 year how I healed and when the fat absorbed and how my butt looked, and then round 3 how the second BBL, which is the third picture, sorry, showing you how the butt looked after. So I had to get that second BBL to get that bottom booty projection. Access said she's Puerto Rican, yeah. So eat that arroz con gandules, okay? Somebody said eating white rice and jerk chicken right now. Eat bulgur wheat, it's healthier and less calories. I'm only looking out for you, darling. Girl, please, who cooking some bulgur wheat in this damn truck? Not me. If I'm home, yeah, but I'm not cooking no damn bulgur wheat in this truck. That's a Haitian thing too. My husband on his side, they be eating that bulgur wheat with not akasan, aranso. What is the fluff fairy? I want lipo and breast augmentation, and they're pushing for a tummy tuck. So let's talk about the fluff fairy, and then we'll talk about why doctors say something else other than what you want. The fluff fairy, usually a lot of people say that they start seeing it around, I saw it around week 10, so 2.5 months post-op after my tummy tuck. And really, I think it's like an illusion to some degree, because at that point, between weeks 8 and 12 is when you see the fluff fairy visit you. It's a combination of the swelling in your body going down, so your waist is getting smaller and your butt is starting to look more shapely, and then you feeding the fat. So the fat that has been absorbed, that 30 to 40% that was absorbed by the body, is the fat cells, I'm sorry, now is starting to expand. So between the waist looking smaller, the butt starting to shape up, you feeding the fat and swelling going down, that's the term that they use when, oh, where did this butt come from? My butt just looked bigger, it fluffed. So that's the whole terminology of what is the fluff fairy, or when will my butt fluff. I hope that explained it. I need more fat at the top for the projection. I'm worried about my hips. I don't want to lose them after surgery. You gotta eat, girl. But a lot of you guys have to take into consideration that the look that you want, you may not get it with one surgery. You may have to go back for a second BBL to either inject more fat in places that it was absorbed by the body, or you may have to go back for more fat to get projection in, whether, like somebody said the top part they need more fat, somebody said the bottom part. One of the comments on the post that I have about what do you call it, about when people say I don't want to get a bell pepper bottom, and I hate that term because some of you women are so fucking disgusting and nasty that you guys like to bad talk other women and use that term in a derogatory manner. One of the ladies said in there, I have to go and get around 3 BBL now because I have a lot of fat absorbed on one side of my butt, on one butt cheek. So she knows already, and she said that in the comments. She was like, please keep educating people because there is nothing you can do. I don't care if you guys never lay down, never sit for a year. There is nothing you can do that will stop your body from preventing fat absorption in certain parts of wherever the fat was transferred, whether it's the butt or the hip or the thighs. There is nothing you can do that will stop the body from doing that fat absorption. Seriously. I lost my hips after surgery. Everyone is different. You were so right about Yili. Along with everything you said, I now see and understand everything you have said. Thank you, Epsilon. Guys, y'all may not like some of the things that come out of my mouth, but before I speak on certain things, especially certain people, I always make sure and research and ask my sources for information to make sure that before I tell you guys something, that this is what is being said and done and people experience, and they have their receipts to prove that, like the surgery sisters post I just made. The girl sent her receipt to show, yes, I paid these people $11,000. So it's not like she just making up a lie and saying anything. You know, like one girl that told me about her experience with Yili. She's actually from my country, and she had breast implants, tummy tuck, lipo, BBL with her. And the breast implants, Yili put like Chinese implants in there, which is like cheap shit. It is not the good implants like Motiva, where they actually give you like a card with the, what do you call it, with the reference number, the serial number, so that they can track your implants. There was nothing like that given to this girl, and now the girl is suffering from like some kind of like allergic reaction where she's breaking out in like hives, like it's affecting her body's immunity. And when she reached out to Yili, she sent me the email to show me what they're telling her. Whoever answers Yili email about, no, we don't know nothing about that. You're gonna have to come back and we're gonna charge you like $2,500 to remove the implants and all this BS. Like, I don't understand why these doctors that make millions of dollars US a year, millions of dollars, why is it that they can't spend a couple $1,000s when there's a patient that have a serious issue to help fix them? I don't understand that. Whether it's 2,000, 3,000 or whatever. You're killing them oxtails on rice. I want around 2, but I still vividly remember that lipo pain. Listen, round 1 lipo I feel is the absolute worst on pain level. When you have lipo again, like you had 360 lipo, like you had lipo on your back when you had your tummy tuck, right? And then you come and have 360 lipo for round 2 like I did, so your back is getting lipoed again. I don't know if it's that the nerve endings were damaged from round 1 lipo so that they never recover 100% fully, but yes, it hurt for round 2, but it didn't hurt as severe and as bad as round 1. The first lipo time, like the first lipo area, that hurts like the devil. But the other times you get lipo, and I'm gonna get lipo again, so we'll see, right? It did not hurt that kind of crazy feeling like round 1. Renee said, I went to John based on your advice and he was the best. I'm telling you guys, I am telling you guys, the people that I work with, that I have on my team, you know, are the freaking best guys. Like, I would not send anybody to somebody that I would not go to myself. That's how I am. If I tell you buy this faha, don't buy this faha. If I tell you go to this person or whatever, I'm telling you is because I would go to these people myself. I would buy these things myself, all of that. I mean, what am I gaining out of sending people to get effed up by somebody? What am I gaining out of that? By sending people to have a bad experience or to nothing. Nothing. Because everybody I refer you guys to, Fahati, buy the Fahatifaha. I'm not getting a commission from Fahati. When I tell you go to John for massages, I'm not getting a commission from John. And when I see John for my massages, you think I'm getting a discount? No. I'm paying John his price, which is $35 per massage that he charges everybody else. And I would not, I think, insult the man and be like, you know, I'm always promoting you. You need to give me some free massages, or you need to give me a discount, or you need to pay me a commission fee for sending people to you. No. That's the man's price, and he knows his worth, and I'm paying it because he's running a business just like I run a business. You know, so I don't ever want you guys to feel like when I tell you guys go to this person or that person is because I'm getting some kind of compensation out of it. No, I'm not. I'm just sending you all the people that I know will do a damn good job because I experienced it, or I trust their expertise or their years of experience or how professional they are or whatever. So please don't ever think that John is giving me some kind of discount or some kind of commission. Nah, honey, I'm paying my $35 just like the rest of y'all for my massages and my hubby massages. There is no 2 in 1. So every time he comes and massages, he's getting $70, believe it or not. Let's see what else you guys are seeing. I'm gonna get to the questions in a second, guys. How soon can you get round 2? Most doctors tell you 6 months. So if you guys saw or did not see that whole issue with the Disladol that got that horrible ass 3rd-degree burn, talking about is a Faha, which I know you all have more sense than that. I know that I'm Faha. She said that she had surgery 3 months prior with Duran, and then come to Disla 3 months later, and she got burnt really bad. So most doctors tell you 6 months after surgery. Me personally, I did not feel after my tummy tuck that my body was ready for another round of severe trauma. After 6 months, I was still swelling and stuff, so I did not have my 360 Lipo until like a year after I had my tummy tuck. Anything you recommend to gain weight before surgery that won't bring down your hemo? So that's a good question. What can you do to gain weight? So what is the reason a lot of people need lipo? Think about the things that you eat in America that makes you get fat. Make you get fat, make you gain weight, and then you gotta go get lipo. So sugar and carbs. In a nutshell, sugar and carbs. I mean, sugar is hidden in so many different things, whether it's salad dressing, condiments, not just, you know, like soda and juice and stuff like that. So sugar and carbs. If you eat that, eat some damn cake and ice cream and drink a soda and go to sleep, I'm pretty sure you're gonna gain some weight. If you're trying to gain weight, you know, to have fat transfer. What can you do for lipo itch? It's crazy. So I just posted that on my page. So that tells me that you do not scroll on my feed and look at the different posts that I make. My girlfriend just got her round 2 and she said the pain was way less the second time. Yep, that's what I'm telling y'all. I'm so happy to hear that the pain might not be as bad. It wasn't on breasts for me. It wasn't even painful, it was just sore. That's how I felt. John is the bomb. I went to him for my first round with Cabral. He was fire, I'm telling y'all. What about Dr. Kira's? I think Dr. Kira's does a pretty good job. I don't know how many dolls he's doing a day now. As far as I know, he was doing 2 or 3. So I don't know if he's up that game to 4. But as far as I know, he was doing 2 to 3 a day. I had one patient went to him. He gave the worst post-op advice, spraying alcohol on her damn incision, all kind of stuff, touching her without gloves. But in regards to results, I think he does a pretty good job. He's well on his way to becoming one of the popular doctors. I had round 1 BBL in the US. I have top booty, no hips. I want to have a round 2 Vixen look with projection on hips. Who would you recommend that is safe? I was more specific this time. So I think that if you want to take a look at my doctors that are not the internet famous doctors. It's on my page. It's in my highlights. It's on the feed, and I post them randomly on my IG stories. You can see who the 4 people are. If you want an internet famous doctor, then that one I can't help you with, because I'm not recommending none of those money hungry motherfuckers. What's your take on Mercedes? Okay, next question. Toribio, yeah, go to him based on who you all getting his name from. She makes very good decisions. Didn't her doctor just have a death the other day? And now she's recommending this man. All right, carry on, y'all. All right, so let's answer some questions. Why do they push for tummy tuck instead of lipo? So Miami doctors, you will see, and who's offended? Oh well, I'm gonna say it. Some big ass woman getting lipo 360 and having all this ugly ass loose skin left back on their stomach, and then they're fooling them with this bullshit about use the tape method. That's gonna make your skin retract. No, honey, you a big girl like me? You fat? No, that don't work. That skin ain't gonna retract with no damn $75 per session tape method. Your ass need a tummy tuck to get rid of that loose skin. So that's why DR doctors will tell you you need a tummy tuck instead of 360 lipo, because they don't want to do surgery on you and then you look dumb, or you look not nice, or it's not desirable results, and then you out there telling people, yeah, this doctor so and so, he did my surgery, look how I look, I don't like it. No, that's why they don't want their name being called up and nothing to people be like, oh, he or she did that crappy ass thing to you. No. So that's why they'll tell you, if you want to have surgery with them, you're gonna have to do a tummy tuck, because they know that they can give you the best results with a tummy tuck opposed to 360 lipo. So some women, for example, whether you had kids or you didn't have kids, you have a big ass gut, a big ass belly, your abdominal muscles possibly separated, and that's also one of the reasons why your belly looking so big. You have all that fat under the skin, and then you possibly have visceral fat, which is that fat that's internal, entwined in your organs, that the only way you can use that is lose it, is by doing cardio, right? You think doing 360 lipo is gonna get that big old belly flat? No. The doctor has to do a tummy tuck, because he has to do muscle repair and pull those abdominal muscles nice and tight, so that way you can have a super flat stomach. If he just do lipo on you, not just the loose skin, you still gonna have a big ass gut protruding in front of you, and then you're gonna be in my DMs, because some of y'all be doing my DMs with this nonsense. Why is my belly still so big? Why it's not flat? That's why. That's why. Let's see what else you guys are asking. Soto is nice, but Soto is known in the surgery community for sharing infections, and I feel like Soto only works good on slim women. If you're a big girl, Soto is not the one you want to go to, that's for sure. Hey Nico. Yep, Nico said it. He doesn't take out enough fat, but he is safe. Alright, next question. What's your Faha brand? Also staying at Butterfly Recovery House for 2 weeks for my first round. Thanks, and then it cut off. I don't know what you said, honey. Faha brand that I recommend, and actually guys, I'm gonna have a video and some pictures to show you all in the next week. I'll be home in Miami on the 13th, and I gotta go to my Faha store to get them to alter my my new Fahas. So I bought, so let me give you guys the rundown of the different Faha brands I've bought and tried, different styles I've bought and tried, and what I like, what I don't like. Fahate is the brand that I used for both my surgeries immediately post-op. Why I love Fahate is because the material, the power net it's called, is nice and oh shit, is nice and tight. It does not have lycra and elasticity in it to stretch. So when you get that faja altered, baby, it ain't moving. It's it's staying right there. It is not moving at all. So that really, for me, is the brand that I say help mold and shape my body and give me like the curve that I have, that I love. After my tummy tuck, I started using about 2.5 months. I started using Lipo Express. Why I like Lipo Express, and I got Lipo Express is literally the name of the website, but I bought it from my Faja store in Miami, Fahatifaha. That's the brand that they sell there. And why I like it is because it has more elasticity and stretch and elastic in it, more lycra in it. So, sorry guys. Sorry, I'm in Atlanta here going through the bypass. Yeah, sorry. So why I liked it is because as a trucker, you know, being active, jumping in and out of the truck, moving around, it was more comfortable for me. The material is also thinner. It's like a mesh kind of material, so it's more breathable and stuff like that, right? Then I did the Alexander Custom Faja. What I do not like about Alexander Custom Faja is the material I feel is too elasticated for dolls immediately out of post-op surgery. So I feel like now that I'm 3 years post-op for my tummy tuck, you know, it's okay because I'm just using it to shape my body, to keep the shape and the figure. But to get that really super tight compression out off the surgery table, I don't like Alexander Faja for that reason. I don't think he is giving, what do you call it, enough tightness in the material, in the fabric. Who from Atlanta? You all be buying your license? Because I swear to you, all these people down here don't know how to drive. Lord Father Jesus. Anyway, so that's why I don't like about Alexander, because when I got the custom faja from him with the built-in bra and the arms, the sleeves, I went from hook number 1 to hook number 3 within 1 week. Why? If you custom measured me and you made this faja nice and super tight, you know, to fit my body, I should not be going through the hooks in a matter of days, right? So I like I said, I like it, you know, because it makes you eat less. You don't eat as much because it's nice and tight on the belly, but it is not that kind of tightness that you need post-op from surgery to get that swelling down. For me, Fahati is still the number 1 for that. So the typical faja that everybody sells and you buy, that has that part here that cuts into your armpit here and it goes under your breast, I don't like that faja because that shit digs like a mother into your armpit right here and it hurts a lot. Now I got hip to the faja with the sleeves built in and the bra, so that now takes away that digging from under here and it kind of evenly distributes the tightness or the pressure, so that you don't have, you know, that digging under here. So I like the one with the bra, with the bra and the sleeves. I also bought from Fahati, so I bought that from Fahati. Now guys, those sleeves are not sleeves for arm compression if you had arm lipo. The material is a very thin spandex material, so that's not going to give you any arm compression at all if you had arm lipo. The 2 that I bought from Fahati, that when I go home I'm going to get them to alter for me, because I need the waist of course altered, right? Because you always measure your hips or the widest part of your belly butt and buy the faja based on that size, because the torso, the waist is always going to get taken in, right? Sorry. So when I get it done and I get into it, whatever, I will do a video so you guys can see how it looks, how I had it altered. I believe I have a video, if I'm not mistaken, on my IG stories. Maybe it's not there anymore, I don't know, on my IGTV, sorry, showing you guys how I get the crutch of my faha customized so that I don't have to take it off to pee and poop, because that's a pain in the ass by itself. Because John, for example, when he puts you in that faha, he tells you, do not take this off until I see you tomorrow to take it off and massage you. Let me see what else you guys are saying. Fahas are a whole other expense, which is why you gotta factor in that post-op experience, because it will add up. Guys, that 3 years post-op, I've probably already purchased about 20 fahas. Seriously. And the reason why is because not just is your body changing size, you cannot be in the same faha straight off the surgery table to like a year post-op, whatever. Because every time you alter that faha and you get them to take in the waist, the faha gets eventually what we call warped. It's not gonna fit you properly anymore, and it's gonna be like digging and hurting into some parts of your body when you wear it. So that's why you would have to get multiple fahas throughout your journey as your body is changing and you have to switch to another size. So I always tell people, buy at least 2 fahas straight out of surgery. And the reason why is because you guys that have a period, you guys that are active for work and different things like that, you don't want to be in a dirty faha with a dirty crutch every day, day in, day out. What are you gonna do? Wash it every day in the washing machine? Wash it and dry it and put it back on? Even when you do that as well, if you guys don't know, using your washing machine to wash and dry your faha makes those elasticated threads in the faha get what we call dry rot. So the faha itself is going to, you're gonna start seeing like elastic threads sticking out all throughout the fabric. It's gonna get dilapidated, where you're gonna have to get a new faha eventually. So I always tell people, buy 2 fahas in the beginning, and then as you know time go on, then get your custom faha, whether it's contour, whether it's tributo, or whoever. The only reason why excuse me, I don't know where I get this little thing in my throat from. The only reason why I do not own contour or tributo is because I don't trust these people to just measure myself and give them those measurements on the internet, and then they give me a faha that fits me. I prefer, like I did at Alexander, let them measure me and make the faha to my size. Because I hear too many people telling me, man, I spent this $250 on this contour faha or this tributo faha, and now it doesn't fit properly. I'll be cussing. I'll be mad as hell if I spend $250 on a faha and then it can't fit me. Also, guys, you guys that want to buy these tributo and contour fahas right out of surgery, you're 5 days out and you're getting yourself measured, you're wasting your money. You're wasting your money, because there is no way in hell that faha is going to fit you when you get it about 2 weeks later, because that's usually how long it takes for you to get your custom faha from them. Your body is changing inches and changing size so quickly within those first couple of weeks post-op that you should not buy a custom faha until you're at least 2.5 to 3 months post-op. You're wasting your money, really and true. It's that simple. There's no other way to explain it, but you're gonna be sorely disappointed and out of $250. So somebody's saying here, I'm a month post-up from tummy tuck and breast lift. My belly button stitch came out and my belly button hole is now one big circle. Should I go back to my doctor in the DR and have him see it back up? I'm assuming you said stitch it back up. I would definitely message my doctor and be like, this is what's happening. What do you recommend? Do I need to come down and see you as a revision, or wherever you live, if there's a plastic surgeon that can help you with that. But if you're not happy with how the belly button is looking, then definitely let him know and see what he says. What about getting weight loss surgery after a BBL lipo tummy tuck? Why would you do it back to front? That's like putting the cart before the horse. Why would you get lipo BBL tummy tuck and muscle repair and then go get weight loss surgery? That don't even, I'm sorry, but that makes no sense to me. Because now you're gonna go and do all of this, and then you're gonna do weight loss surgery, possibly have loose skin after you lose a bunch of weight, depending on how fast you lose it, and then you're gonna have to go back now to get a body lift, to get all kind of different stuff done. What do you think about Team No Faha after only wearing one for the first 2 weeks? Really, Marquisha, because you've been following me too for a while. Really? I ain't even gonna answer that question. Enjoy wasting them thousands of dollars on surgery. I was fortunate my tributor fit perfectly, but I didn't get it until I was 2 months post-op. See, you smart. You know, they haven't contour measure your ass 2 days after surgery talking about they're gonna give you a custom faha. Can belly button holes close up on their own? Yes, I have seen girls that have no belly button because I don't know all what crazy stuff happened to them, and then they did not take care of it, and it literally like closed up where there is no belly button. Like literally they have to like tattoo on a belly button. All right, what do lipofoams itch under my Fahati? I'm wearing a t-shirt under it. Or why do lipofoams itch? I'm wearing a t-shirt under it. So the layers you should be wearing your stuff is your tank top, well actually I put my bra on first. I put on my wireless bra when I'm wearing my faha, because the bras with wire, for me it digs and I don't like how that feels. So I put my wireless bra on, my soft bra, then my tank top, then the faha, and between the tank top and the faha is where you're gonna stick your lipofoam. So your lipofoam should not be touching your body to make you itch. And if you have lipo itch, then on my feed has that, what do you call it, thing to do, the stuff to buy to get to rub on your skin to help with it. Let's see what else you guys are asking. Best BMI for DR doctors in your opinion? I feel like if your BMI is 30, adults who are like 28, 30, I feel they see the best results in one round. If you are above 30, then and you have a certain look that you want, prepare yourself for possibly multiple rounds. And if you are over 32, 33, know that if you're getting a tummy tuck, the doctor cannot lipo the front of your belly, so you are not gonna have that vixen look that you may want. You're gonna have to come back for a second round of 360 lipo. So I feel like people who are 28, 30 get the best results with one round of surgery. What can you take to gain weight but that it won't affect your hemo? Oh, I answered that question already, because I don't know what supplements or whatever that you guys be taking, like what they call it, apetamin or something like that, to gain weight. I really don't know what that is and if it really affects your hemo, to be honest. What if you have dietary restrictions and can't eat a lot of carbs? Well, girls, then tell yourself you're not gonna have a big ass booty. Tell yourself that you're gonna have probably a nice natural look, you know, definitely better than what you had before, but it's not gonna be no big old jiggly sending, you know, ripples all over the damn place, but that you're gonna have something that just looks nice and firm, you know, in your when you wear your clothes. That faha was the devil, but that devil was with me every day. Heck yeah, I still wear my faha. Like I just told you all, I just bought 2 brand new fahas. I don't wear it every day now, don't get me wrong. At this point in the game, I don't wear my faha every day, you know, but I do wear it every couple of weeks for, like, let's say the last time I wore it, actually I had it on 2 days ago, and before that I probably had it on about 3 weeks prior to that. But when I do wear it, I'm gonna wear it for 4 or 5 days. I'll be in the Faha, and then I'll take a break again for another couple of weeks. But I cannot stress enough, guys, even though you had surgery and after 6 months you're no longer wearing the Faha, or 1 year you're no longer wearing the Faha, you still want to randomly wear your Faha and have it nice and tight and firm to keep the shape of your body. And more than one person has messaged me and tell me that when they don't wear their Faha, after months of not wearing the Faha, why is their belly starting to poke out? Why is their belly starting to look like, not swollen, but I don't know, bigger is the best word I can say. Like, why is the top, especially under the breast, above the belly button, why is that area poking out now? And that's because they're no longer shaping their body or maintaining their shape and figure by wearing their Faha every so often. That's why that's happening. My girlfriend had to take off her Faha after 6 weeks because the incision under the butt got infected. The doctor told her to take the Faha off till the incision dries out. How long should she wait to put it back on? So let me get this straight. She's 6 weeks post-op. I don't know what procedure she had. She's not wearing her Faha because the doctor told her let the incision dry out. So there's multiple questions I have for your question. How is her wound looking that the incision or the cut or the wound or whatever has to dry out? How is that looking? So that would be my first question. How that's looking to say that the wound is getting better or it's getting worse. I don't believe in this airing out wounds and it's gonna heal. And the reason I say that is because in the Caribbean, that's what they always tell us. To let the cut breathe, let it dry up, go to the ocean, take a sea bath, put some salt on it. So this is what why I like that and I don't like that idea. Because when I had my leaking belly button, which is a common post-op complication from tummy tuck, that's what I did. I was 5 weeks post-op, I started getting the leaking belly button, and I left my Faha off for a whole week. It didn't do shit. That letting it air out, breathe out bullshit, it didn't do nothing. And I was miserable because I was full of fluid, like ridiculously full of fluid. So when people get, like, for example, lipo burns, and they have these, deep wounds and raw wounds and stuff, there's different things that you have to do to get these wounds and these cuts to heal. So airing it out definitely ain't it. If you want to air it out, let's say you don't wear your Faha for an hour or whatever, but then you cover it back with, your gauze and tape and stuff, you gotta look up for yourself, wound care, different techniques that wound care specialists use, different things that they use. Like, they have all these different type of gauzes and pads that they use on these wounds to get them to heal quicker. Using saline, the salt that helps dry out the cut to get the scab to start forming better. So my thing is, it depends on where your friend is in regards to that incision and that wound healing and getting better before she puts back on her Faha. If she can wear her Faha right now, but make sure and keep that area nicely covered. Now, if the Faha is tight and pulling on the incision or the wound that's open and raw or whatever, then no, she don't want to wear the Faha because she doesn't want like any pressure pushing on that raw cut or wound that's gonna make it like pull open and not heal. It's gonna stay raw. So there's more than one way to answer that question based on how she looks, what it looks like, where she is in her journey to get that wound to heal. Give me 1 second, guys. I don't know if it's coming from Florida where it was 70 something degrees to Georgia where it's like 40 something degrees. I don't know if that's why my throat got a little frog in it. So bear with me. Is it really necessary necessary to fly first class back home after surgery, and if not, what airline is most comfy. So out of Miami, because I flew out of Miami and Fort Lauderdale, I flew JetBlue and American. American had first class, and JetBlue did not have first class. JetBlue just had like a bigger leg room seat, like to the front of the plane. I booked that after my tummy tuck with JetBlue, the bigger leg room seat. My flight is only 2 hours to Miami, so I didn't even get up during those 2 hours and walk around the plane. But for you guys that are on longer flights, you know, that 7 hours or 5 hours or whatever, then I would say get either first class or get the seat by the exit door that has all the leg room, so you can stretch out your legs. You can get up and walk around like every hour or 2 hours on the plane and come back to your seat, you know, because if you're on a long flight, the between the flying and, you know, the what they call it, compression in the air chamber, whatever, all of that gonna have you feeling really bloated, really tight, really uncomfortable, you know. So I would say yes, if you can afford it, then definitely do it. I should probably mention I took a hydrocodone before my flight home. I don't even know what hydrocodone is. Get the wheelchair service on the way home. So, well, let me tell you all why I don't recommend wheelchair service. Because some of these people, first of all, the DR, well, I guess if you're in Miami, that's a big ass airport, because the DR airport is super small, so there's no long walk to say you gotta walk from the check-in counter to the gate. It's like right there. It's 2 floors only is their airport. Why I don't like wheelchair service in the DR leg of service is because people have complained that when they took the wheelchair service, the TSA agents basically in a nutshell told them, come with me, we're gonna search you because we want to make sure you're not carrying drugs inside your clothing, because they feel all that padding on your faha and whatever. And when they got them in the room, they're like, okay, you gotta take your faha off. Now remember, these people don't even talk good English, so imagine trying to communicate with them if you don't speak Spanish. Take your faha off, or if you don't want to take your faha off, you're gonna have to give me a tip. Basically, they're telling you, bribe me, or I'm gonna make you take your faha off. Once you take that faha off, you know in hell you can put that faha back on yourself with all them pads and whatever. So you run the risk of that happening to you. If you're okay with that, then get your wheelchair service. But for that reason, that's why I don't recommend getting wheelchair service out of the DR. Also, you don't want to fly with poisey pads and lipo foam and all of that in your faha. You want to put that in your faha maybe when you get to Miami or whatever airport you're flying into in America. Because in the DR, once they feel all of that, because yes, they pat you down with their arms, and once they feel all of that with the under the faha, they feel the buttons of the faha and stuff, they're gonna pull you aside to search you, and it's a very embarrassing, humiliating search. Round 2, my husband, they did that to him. He did not have any what do you call it, pads under his skin or lipofoam. He simply had on his wife beater and his faha. They felt the hooks in the front of his faha, the male employee, and of course nobody is saying anything in friggin' English, so we don't know what the hell is going on. They're telling him come with him. They're telling me I cannot come with him. They're not telling me what the hell is going on. They take him to a back room, so now I'm standing there in the TSA line wondering what the hell is going on. Where's my husband? Nobody can give me an answer. Nobody could even talk to me in English. They had him there for, I don't even know how, it felt like such a damn long time. Finally he comes back out and he tells me that they strip searched him. They made him get butt ass naked, bend over so they can see his butthole, and made him cough. So if any of you ladies want to go through that level of humiliation, that's why I'm recommending do not go with the wheelchair service, and do not go with any kind of pads or foams under your faha. Just wear your tank top and your faha when you're traveling on the plane, and when you get back to America, then put some lipofoam or whatever if you can inside your faha. So that's my experience firsthand. Let's see what else you guys are seeing in the questions. You're lucky you didn't have TSA problems. This is not my first trip to the DR. This didn't happen every single time, but it happened that one time. So that could be somebody else's one time going to the DR and experiencing that. Marina said she's going to go in her faha and shorts. You all saw that damn lady with the picture with the faha checking in at the counter. She was in her faha with a t-shirt on, and that was it. This F ain't had on no drawers, nothing. Yeah, I don't know if it was racial profiling or what, but that's what they did my hubby. And that was that one trip. The other trips we've taken to the DR, they haven't done that. But that's, you know, in the Caribbean, and that's not just the DR. And Miami too, they do you like that. Don't feel it, don't do you like that in Miami. They'll tell you to bend over and cough, because they want to see if you are coming from a hotspot country, which the DR is, and a lot of the Caribbean islands are. Hotspot countries that people transport drugs. So they will make you take your clothes off, bend over and cough to see if any drugs are falling out your butt or your vagina. I was just watching that on TV the other night too, one of those narcotic shows that they have on A&E or one of those TV shows. Let's see what other questions you guys have. Why does some doctors use drains and some don't? Well, I would say the ones that don't use drains, that is for lipo. Every doctor I know in the DR uses drains for tummy tuck. Some does it for lipo, some doesn't do it for lipo. Some do it for breast surgery, some do not do it for breast surgery. The ones that don't do it, just know that means that you are at a higher risk of getting a seroma. So example, when I had my breast lift and reduction, Lauren put in drains in my breast. They were removed about a week after surgery, and that video is on my channel right now. And what do you call it? I had one doll that went to Disla and got her breast done. Sorry guys. That got her breast done, and she she got implants, and she did not get drains put in, and she got a nasty ass seroma. Her nipples started separating. Her whole bottom of her breast turned blue-black. Disla, while she was there, I think she stayed almost like a month in the DR. While she was there, Disla was draining the fluid out with a needle, telling her to put warm rag on the breast to help with the blue-black mark and whatever. So that was her experience, and that is what happens to you if you get some surgery done and the doctor does not put any kind of drains. You run the risk of getting a seroma. So as to why some do it and some don't, I guess that's their preferred technique, but that's the repercussions of it not happening. Of what will happen to you if you don't get them. How did you calm your nerves before you got your first round? You know, I wish, you know what, I really need to go on Facebook and screen record that video I did in the Dr. Laurent Facebook group when I had my round 1 surgery. Because minutes literally before they came and took me to go have my surgery, my husband and I was doing a live and we were talking, and I really wasn't nervous. I mean, I had a little bit of nerves, but it wasn't like really off the chart, my blood pressure high nervous. And I think it's because I had full confidence in my doctor, in the sense that I knew he was a hidden gem at the time. He was an unknown. He was, you know, building his reputation. He was known for being safe. He didn't have infections. He didn't have deaths, nothing like that. So that gave me the peace of mind knowing that I'm healthy. I'm going into surgery with somebody who, you know, is taking my health and my life very seriously. You know, I'm Tahad. So I feel for me that's why I wasn't, you know, like, oh my God, I think I'm gonna die, whatever. And that's one of the main reasons why when I keep telling you all, stop going to these famous ass internet famous doctors, is because it's a slew of repercussions and consequences and bullshit that you guys may have to deal with by going with an internet famous doctor. I mean, off the top of my head, I could just tell you automatically, if this doctor is doing 4, 5, 6 girls a day, you know, imagine how tired this person is, how tired they are. If they're not tired, why are they not tired? Because somebody else is doing their damn surgery for them. They're training other MDs, other doctors to become plastic surgeons, and they're using your body as the example to practice on. Because how does somebody become a plastic surgeon? By just looking and not touching and not doing anything? No. They become a plastic surgeon by literally doing surgeries on living human beings. And who are those guinea pigs that they're experimenting on? You and I. So that's where you gotta make a choice. Am I going to a doctor who is only doing 2 people a day, or he's not super busy, so maybe he's only doing 1 person a day because he doesn't have a lot of clients booking him, so he's really taking the time to do my surgery himself. He's taking his time to, you know, perfect everything he's doing, you know, to build his reputation, build his portfolio. You gotta pick sense from nonsense. A lot of you guys are just seeing all these internet famous doctors that have all these beautiful, wonderful success stories on their social media, but you're not seeing all the people that are unhappy, that are burnt, that have bad results, that are not happy with how they look and whatever, you know. So these are some of the things that you got to think to yourself. Is this person only concerned about my $5,000, or are they really concerned about my life, my well-being, my health, and so forth? Pick sense from nonsense, guys. Can you make your own Facebook group, please? I quite enjoyed your vibes and helpful chatter. I do have a Facebook group. Y'all be wondering why I'll be posting over and over and over the same shit in my IG stories. It's because I guess people are not aware that I have YouTube, I have a Facebook group, I have a Facebook page, I have an Amazon store. What else do I have? I don't have Twitter. So I have Facebook, YouTube, Instagram, and Amazon. And all of them, the link is right there in my profile. You click on the name Surgery Bay in Instagram, and then you click on Linktree, and from Linktree that will take you directly to the page that shows all the different social medias I have. When you click on each one, it takes you directly to the group, to the Amazon store, to the YouTube channel, everything. That's why I'll be posting that over and over, guys, because there's still people out there that don't know I have all these different social medias. How long after I land can I do my labs? I want to go straight to the hospital. I know you're asking and saying you want to go straight to the hospital to do some damn surgery the day you land, right? Dominican Dolly, Mammy. I don't know about other doctors. I can only tell you what I book with my clients. When you most of my clients, I tell them I want you to land either Sunday or Monday, because doctors do not do surgery on Saturday, Sunday. They're not in the office to come and take their payment and stuff Saturday and Sunday. The reason why I want my people to land on Sunday or Monday is because you land on Sunday, you relax, you check into the recovery house, you know, you get a good night's sleep, you get something nice to eat, you're tired, you're jet lagged, this, that, and the other. All that stress can affect your blood work, yes. Then Sunday night, you're going to stop eating, let's say 9, 10 o'clock at night. And then next morning, Monday, you're going to go to your doctor's office where you're going to go do your labs. They're going to tell you where you're going to do your labs. And then the next day, Tuesday, would be surgery. If you land on Monday, then Tuesday's labs, Wednesday's surgery. The reason why I like my people to have a night of rest, relaxation, sleep, good food, and then go and do labs the next day is because I want your body, first of all, to have some rest. You're not jet lagged, depending on how far you flew from. And I want you to fast that night, so that when you go and do your labs, you will get an accurate reading for your blood glucose. So that's the reason why I like my people to do labs the very next day, not the day that they get off the plane. Just know that the reason why some of these doctors are telling you all they want you in the DR 3 days or 5 days before surgery is because they don't want you to get a damn blood clot and die while they're in the middle of surgery. Because your body needs to have some kind of rest before you start doing all of this traumatic stuff to the body. Jackie, why are you so damn pretty? Like I said earlier, Jackie, I'm just drinking my water and minding my business. That's all I'm doing. We ain't got time for all the extra shit. Where do you buy your Fahatifaha? So, for people who are not my clients, the Fahatifaha, you can buy it in the Dominican Republic. They have a Fahati store. It's still, the store is in the same plaza that Alexander Faha has his store. So, it's about 5 minutes or so from Zipla. It's the store. For people who are my clients, they can buy their Fahatifaha for maybe 1/3 the price. It comes straight from Colombia on their website. And that information I only give to my clients, because like the 2 Fahas I was saying earlier that I have to go to Miami when I go home and get altered, I bought those on the Fahati website. Let me see. Let me see what else you guys are seeing here. I was not interested in anyone who did more than 3. Mora made me too nervous. I think Mora is doing 4 or 5 a day now, because my client went to him in October, was it? Yeah, October, and that day he did 4. So I don't even know I don't remember what number she was of the 4. I think she was number 3, if I'm not mistaken, of the 4 girls. So yeah, those numbers, anybody doing beyond 3, you gotta watch them side eye. I want to go to DR and meet with a couple of doctors and then decide. I think everybody should do that. If they can afford to take a trip down there for 4 or 5 days, I think everybody should do that. Go meet your doctor in person. Have a top 3 or a top 5 doctors you're interested in. Go meet them in person, talk to them, see what kind of vibe that you get from them, you know, and then decide which of them you think is the one for you. A couple of years ago, I was new to this surgery thing and I was clueless, so I get it. Yep, and a lot of girls, a lot of women are out there and they don't know about the ins and outs of surgery. You know, it's like, I think some people, like, especially the younger crowd, the ones that are in their 20s, I think they think they're immortal, and it's, oh, let me just book a flight and, you know, get my passport and go down there and everything is hunky-dory. It's not. Especially the people that love to party, that love to drink and smoke. I just posted about that blue pill, and they're talking about you drinking alcohol and then going and getting this damn sedative for surgery, and it's slowing your breathing and possibly killing you. Well, people who are going to the DR are talking about, I'm healthy, my sister was healthy, my friend was healthy and they died. Well, was your friend drinking and partying and having a good old time in the DR before surgery? Because some people go down there and do that. They go down there for surgery, and instead of, you know, everything being surgery related, they're looking for where's the club to go to, going out and having drinks and you know, smoking hookah and all of that. You know, people won't admit that, you know, because they know it's dumb shit they're doing. But some people be down there doing that shit, trying to hook up with local Dominican men, you know, trying to get some damn sex before surgery. Like who the hell does that? But there are people out there that does it. Leave it on that. DR 5 days before surgery due to COVID. That's not true. That's Tanya Medina and her foolishness, talking about 5 days before surgery. The same day you're doing your blood work, your urine test, your EKG, your x-ray, everything is usually, if the doctor assistant is organized, everything is done in the same day. That's the same day they're doing the COVID test. So you are not needed to be in the DR no 5 days before surgery because of a damn COVID test. That's bullshit. What about going to see a couple of doctors, deciding, and then having surgery all in one trip? That's a wonderful plan if you have 3 weeks to take off of work. Because guys, remember this, especially guys that are having a tummy tuck. Unless you have an awesome ass bomb masseuse where you live that's going to continue those lymphatic massages, continue training your body in your faha the proper way, doing that needle aspiration to get all that fluid out of your fupa area so you don't get a damn seroma or infection, you want to keep your ass in the DR for minimum 12 days after a tummy tuck, because you want to get all that fluid out of you. When I had my Lipo 360, by day 9, John couldn't even find fluid in me anymore with a needle, because he's that damn good, right? But with my tummy tuck, I stayed in the DR 2.5 weeks after surgery, and even though he's that damn good, my body produced so much fluid after the tummy tuck compared to the 360 Lipo that my husband still had to drain me with a needle up to almost 6 weeks post-op. I was getting drained with the needle still, and he was getting enough fluid out of my fupa area. And I had fluid in my back too, but I wouldn't let him drain my back, because that shit was too painful, and he's not professional, and I don't want him sticking no damn needle by my spine. So I didn't drain the back, but the fupa area in the front, that is how long myself and most of my clients also drain their fupa area after a tummy tuck. So you want to stay in the DR for as long as you possibly can to get that fluid out, to get those massages out, to get that drain out before you come home. Markeisha, if you're 20 and you're the exact opposite, that means you are a remarkable 20-year-old. Because most people your age, they need Jesus, because somebody ain't giving them guidance on how to live life or how to do things in life to be successful. Thank you, Snatched NYC. I want to meet with 2 doctors, but I don't know how that's gonna work out. So if you're gonna go down there to the DR and have surgery at the same time, or you're just gonna go to meet doctors, you want to get to the doctor office in the morning bright and early, like 7 a.m. for when they're opening up, so you can be one of the first people there, so that when they do come in the office, like UCBO waltz in around 9 a.m. So that they can see you and give you an in-person consult. I stayed in the DR for 20 days, took the first week off, and worked remotely for the last 2 weeks while in the DR. See, that's a nice plan. I like that. Marina Mommy said I will be there 23 days total. That's a really nice ass trip too. So that by the time you leave there, you shouldn't even have fluid in you if you're getting just 360 Lipo. How long do you need to get massages, and how often? So people that are getting just 360 Lipo BBL, or Lipo anywhere, arm Lipo, thigh Lipo, torso Lipo, you want to get, while you're there in the DR, if you're there for 2 weeks, you're going to get a daily massage, right? When you come back home, you want to get massages professionally. I would say for, let's say, the first 3 weeks, 2 to 3 times a week. After that, you can cut it down to maybe once a week for another 3-4 weeks. But you yourself needs to be massaging your own body yourself every day for the first couple of months, like 3-4 months, every day before you go shower. If it's twice a day you shower or once a day you shower, rub yourself down with some coconut oil and massage your body. Because if you don't, that's where not just fibrosis happens, but that's where when you heal, your skin gonna be looking lumpy bumpy. don't want that. You want your skin to heal nice and smooth. So people have all these miracle lipo tools that they like to sell. This roller, this thing, this handheld massager, this whatever. Your fingers are some of the best tools, because that's what's going to need and dissipate all those lumps and bumps that you're feeling under your skin. My hubby, he used to use a rolling pin, like the one you use in the kitchen to roll out dough. He used to use a rolling pin to roll while he's driving. He used to be doing that, rolling his belly, rolling his sides and stuff. You know, every chance he got, you know. And then daily, when we're doing our daily self-massage, we would massage like each other's back, the areas that the other person couldn't reach. So that's for lipo. For tummy tuck, I would say the schedule would be roughly the same, 2 to 3 times a week, to go see your masseuse for the first 3 weeks or so. But same thing as well, all the lipo areas, you want to make sure and massage that, because nobody wants to heal with lumps and bumps, with getting a seroma, with having fluid remain in your body, and that lead into an infection, to cellulitis. Hey, Miss Brave. You know, a lot of people, they get infections and they blame it on the doctor, and it's really, the doctor had nothing to do with that. It's the person with their terrible post-op care. That's why they got the infection, and then here they go blaming the doctor and the surgery center and all of that. So my thing is, okay, for example, a couple of years ago, there was a big old article about Cabral having, they blamed Cabral because Cabral owned Cipla, and the infections came out of Cipla, and it was like about 7 or 10 girls in New York that got infections after having surgery in Cipla, and the CDC got involved and whatever, and they all traced the infection back as like coming from the same source, and then they realized the common denominator was Cipla, right? Well, it was Yili. You guys that talking about you want to go to Yili and you love Yili and blah 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 blah, it was Yili de los Santos. She used to work out of Cipla, and when that happened, Cabral, after that, Cabral kicked her out of Cipla, and that's why she no longer works out of Cipla. And the reason why that happened is because Yili was booking all kind of 10 girls in one day. And the doctor that told me this information, yes, the doctor that told me this information said Cabral told her, you need to stop booking these 10 damn girls a day. You know, if you're gonna book, you know, book maybe 5-6 girls a day, but not no 10. She didn't listen. She still did what she wanted, and that's what happened. Now, you and I both damn well know that booking 10 girls a day, 8 girls a day, 7 girls a day, that means that her assistants are doing the surgery. That means that it's not her who's doing the surgery. She may come and she may watch and she may start, she may be in the middle, she may end, you know, she may do a little lipo, she may do your breast, whatever, but she's not doing your entire surgery. The same way there was a picture circulating where Cabral was standing with his hands behind his back, watching, and what do you call it? The girl in the ER, in the operating room, sorry, took the little selfie with Cabral behind her, watching the other doctors do somebody's surgery. That's the reality, guys. That is the reality of going to famous doctors that are overbooked and busy. A lot of you guys are going to learn the hard way. You're going to be disappointed, and pray to God you don't learn the hard way with your life. That you just learn the hard way by having results that look bad, or you don't like how you look, and you can go back to another doctor and get that corrected. Hope that you don't go to a doctor that you end up dying, or you end up getting an infection or something, because this is another thing that you guys need to consider. When I had surgery in Cipla, and I had my facial surgery in Dr. Lawrence's office while I was awake. So my facial surgery was a whole separate surgery, not in the operating room. It was in his office, which is the buccal fat removal and the chin lipo, right? The way that they sterilize the medical tools in Cipla, and then they wrap it in like brown paper, And then they put some tape on it, whatever the doctor's name is written on it. So that's how they know, okay, these medical tools belong to this doctor and so forth. Now, I don't know if the sterilization and cleaning of the tools is done by the doctor itself, by his or her assistants, or if it's done by staff that works in the hospital, in the clinic, right? So when Dr. Lauren did my surgery in his office, I saw him pulling out all the sterilized hospital gown, all his tools with his name on it, out of the brown paper. In the operating room for my round 2, I saw the same brown paper with the tools wrapped in there. Now, medical tools, if you guys don't know, scalpels and all this other stuff are expensive. They're not cheap. Just like the Vesa machine is, I'm gonna tell you all, hold on, because Dr. Lauren showed me the price from the medical representative that sells them. He showed me 2 machines, and I'm trying to remember which one was which. The Vesa machine, there was 2 machines he showed me. One was $25,000 US and the other one was $75,000 US. And I think the Vesa was the $75,000 US machine, and the $25,000 machine was like all the cannulas, special cannulas and stuff that goes with the Vesa Lipo. Anyway, if a doctor is doing 10 patients a day, 5 patients a day, 6 patients a day, do you guys think that these doctors are buying 6, 8, 10 total medical tools that is needed, like total packages of all the medical tools that they use? Or do you think that these tools are being reused from one patient to another? So when you hear, like for example, with Yili and these 7, 10 girls getting infected and it all came from the same source, that tells me that these assistants are probably reusing the same tools and they're not sterilizing them. That the doctor may not have 10 sets of scalpel sets or whatever the heck medical tools are called. That they don't have a full, brand new, clean, sterilized set for each patient. So, Surgery Bay, Roberta, don't be talking shit that I haven't seen with my own 2 eyes, or I don't know. I'm telling you all what I saw with my own 2 eyes in Cipla with Dr. Lauren. Now, Mercedes, who works in CSIP, doctors that work in CSIPLA, doctors that work in not CIPLA, what do you call it? All the other Monumental, wherever, all these other surgery centers whose names we hear out there. I don't know. I don't know because I haven't had surgery and I didn't see with my own 2 eyes. But I can tell you what I saw with my own 2 eyes in CIPLA. So I am assuming that the procedure and process is similar in the other hospitals. That they clean these damn tools and that they write the doctor name on it and they put it aside wherever so that they know what belongs to which doctor when he's in the operating room, what to go and get and bring in there to set up and so forth. Right? So all of these things you guys may not think about. You may not think out the box. You may not think, well, my doctor is not like that because, he's this, that, and the other. Well, again, internet famous doctors, you're only hearing the positive stories. A lot of these groups that you guys are in on Facebook, these Dominican, this, that, and the other, whatever, the ones that love to be in there gossiping, bad talking people, bullying people, deleting comments, deleting stories. I don't know what they may or may not be getting from these doctors that they're writing so hard for them. I'm talking about like Detsenia, for example. You always hear about these girls having all these horror stories about getting burnt from him, getting killed by him, and then when they try to give their story in these groups, his cronies are deleting and blocking people. Why? I would never understand how disgusting some of these women are. That you all would prefer, right, that another woman go to this killer, whoever. It could be whatever doctor that's sharing infections, not just that Senia. right? All of y'all who write for these doctors, die hard, and these doctors would never even invite you to their damn friggin' house for dinner, or buy you some damn flowers, or send you some damn gift or whatever to tell you thank you for being my patient, I appreciate you, whatever. You all write for these doctors, and then you all get repaid with getting burnt or getting killed, right? I would never understand why. And if you all are watching my video, I'm talking to you. How could you not want to share pertinent information to your fellow surgery sister, to another woman whose dream is just to get a nicer body, to another human being that could potentially save their life or save them from getting some kind of maimed, hurt, injured, burnt, death, whatever, or just pure bullshit and heartache and headache? Why would you not want to warn them and be like, you know what, this is my story, this is what happened to me, and leave those stories in there in these Facebook groups? No, instead, what are you all disgusting ass evil human beings are doing? You all going in there, deleting comments, blocking people, and then arguing with these women, making up all kind of lies about them, talking about they bleach their skin, they smoke cigarettes and hookah and all this shit. Why? I will never understand that. Never. Never. Why would you want somebody to go through that kind of foolishness when you have the platform to help somebody not go through that? And then some of y'all wonder why your life is shit. Because that's the universe. That's the universe. That's karma. That's the universe giving you back the same energy that you're putting out there. I'm not perfect. I have my days when I have anger issues, road rage. People get me upset when I go in a store and I want to buy something and they're saying I'm doing whatever. I don't get what I want. I'm not perfect. But I know consciously, maybe 90% of the time, that I try to live my life in a good way where I'm always putting some kind of positive vibration out into the universe. Like today I was in the damn truck stop. I went to get some tea. This lady had some cute sneakers on, white with fluorescent pink and yellow. And I love bright colors. What did I say to her? Oh, you have such nice sneakers, I love them, wow. They're so beautiful. I give her a compliment, a random stranger. I could never understand for the life of me. And I'm pretty sure that made her day, because she smiled. You know what I'm saying? She smiled and she answered me in a nice, polite manner, whatever. Even if she was having a bad day, I don't know. But for the life of me, I cannot understand why, this surgery community, surgery sisterhood, surgery sisters, whatever you guys want to call it, why people just cannot be nice to people, helpful to people, polite and friendly. Some of you guys will be like, well, Surgery Bay, when I write you, sometimes you don't even answer me, or you answer me like a bitch. You know why I answer short, one-word answers, or direct, blunt, to the point, whatever? Because some of y'all be coming in people DMs and y'all be like this. What's good for lipo itch? No hello, how you doing? Good morning, good afternoon. I have a question. When you get time, can you please answer it? None of that. No manners, no politeness. Like you all were raised by roaches, right? Human beings didn't raise you all to teach you all manners. That's why I answer some people like that. Sometimes that's why I friggin' don't even answer at all. I'll read it and I wouldn't even respond. That's why. Let me read what you guys are saying here. What happened to Dr. Contreras? He was a nightmare. Edgar Contreras is still one of the founding fathers of surgery in the DR. Cabral used to work with him, if you guys don't know. Contreras used to be the so-called king of the Barbies before Cabral took that title. He's still operating in the DR. One of my patients actually went to him about 6 weeks ago, and he did a damn good job on her because she looks beautiful, but they took his license. He can't go back to New York. All kind of crazy shit. Same thing. The same thing that is in his past is the same thing that happens with a lot of these internet famous doctors. When they get famous, everybody starts going to them. Now they start going from, let's say they were doing 6 patients a week, to now they're doing 15 patients a week, 20 patients a week and more. So of course, what's going to happen when you have more customers, more dolls, more people having surgery? That means shit's going to start happening. Infections, death, burns, Now you're hiring more doctors to work with you as assistants to handle the workload. They may not be what do you call it, as skilled or experienced. So now people are getting lipo burns because these doctors, they're being too aggressive. Why are they being aggressive? Because they want to deliver results. Because you all be going down there like, suck me dry, I want to see my ribs. Well, that's what happened when you say suck me dry, I want to see my ribs. They're being aggressive with the lipo. You all love Duran and Disla. Oh, because they produce results. And then guess what they produce too? Stank ass burns, because they're so aggressive to give you all the results that you all love. Prime example, I posted that girl right there in my IG stories this week. The one that was in New York that came out, Plasti Muñecas, put her up on their page. That this is what happened to her. Talking shit about there's a faja burn and a faja burn. And I even put in my IG stories for you guys that do not look at my IG stories daily. You're missing out on a lot of shit that I don't put on my feed. To show you guys and prove to you guys what a faja burn looks like versus what a lipo burn looks like. Them groups are a mess, but they can be good for making lists and getting tips. You have to be able to filter through the BS. Bingo. They don't care, that's why they still go to Desenia. One of the group leaders died after going to Desenia. Yep, what was her name? And they said Marcia or something like that. And after she died, because she put up on her Instagram that she was taking a Versace robe for him and a Louis Vuitton portfolio for his assistant. And then when she died, people started coming forward and saying how she was one of the, like you said, group leaders, whatever. And then when women would come in there and ask questions or try to give their story, she would bully them and make all kind of nasty comments to them and delete their stuff and whatever. Guys, I just spoke about the energy you put into the universe. I just spoke about that. I'm not dancing on this woman's grave. I'm not happy that she's dead. I'm not saying that's good for her. But what I am saying is that these doctors don't give a shit. What kind of loyalty is that? What kind of loyalty is that to your group leader on Facebook that's promoting your work, that's fighting women down for you, that's bullying people, that's arguing with them, that's whatever, and then what the heck did you do to her that she died? Come on guys, pick sense from nonsense. I got kicked out of a group for talking about something my nurse told me about a surgeon when I was there. I'll never understand either. I didn't cross any nasty woman until I came to this community. No manners. Yep. Let me tell you guys, let me tell you all. Even myself, I guess I have been a very naive, sheltered person my whole life growing up. I am an only child. My parents was very strict. They raised me very conservatively. That's why you will never see Surgery Bay on the internet twerking, shaking my ass, bending over, letting people see my pussy lips. I don't do none of that shit. I was raised very, very conservatively. And as an only child, my father raised me in a manner to think about myself as a woman, as a young lady, especially growing up, you know, of what is my biggest treasure, or what is my biggest worth as a woman, my reputation, my family's name, things like that. You know, things like that is how a lot of us are raised in the Caribbean. Our reputation means everything to us, because those of us that are raised in the Caribbean, that are raised in little villages or little towns, everybody know everybody. And you don't want everybody in your neighborhood or in your town, whatever. Oh yeah, that's Paul's daughter. Yeah, she's a real hoe. This boy down the street, he was like, yeah, he and she been, you know, doing it for like the last 2 weeks, whatever. And that's not even his girlfriend. Yeah, and then he friend get a piece of the action too. That's how we're raised in the Caribbean. Okay, your reputation means everything. Your self-image as a woman means everything. And more power to y'all who are into the whole showing your nudity, your naked body on the internet, doing what they call it, some silhouette challenge and some red filter, and you're standing up naked, whatever, in the door. Guys, I'm old. I'm not into these 20-year-old people that live on the internet. Every Monday morning is a new challenge. I'm not into all of that. I got better times to use the internet to do other things to make money for me. That ain't making me money, all right? So I'm not into all of that hip stuff that you all are into. But I'm just saying, as a woman, that's how I was raised. So people be in my DMs talking about, oh, surgery, why are you talking about sex workers like it's so horrible? Why are you talking about strippers like it's so horrible? This, that, and the other, whatever. Because that's how I was raised. That's how I was raised. That women do not do, decent women who have morals and values, who are raised what we call the right way, do not do things like that. They don't be bending over and showing practically the inside of the uterus to men on the internet, to random strangers. Okay, they don't be in thongs shaking their ass and showing the color, the crack of their butt. They don't be doing none of that shit. People who are strippers, I know what y'all do, because I've been to the strip club many times when I was in my 20s, and I see how hard you all work for that $1, for that $5, for that $20 lap dance. I see it because I've been there. That'll never be me. Okay, unless, I don't know, you all stripping for some big time baller or whatever that's showing you all in $100 bills, then okay. But I see how hard you all work for that $1 tip, and that will never be me. I don't care how nice my body look, that will never be me. Probably I'm my ass too old to be a stripper anyway, but I'm just saying, more power to you all. If you all want to be sex workers, you all want to be strippers, you all want to be, I don't know, IG models, whatever the hell they call themselves now, the ones that always be on the internet naked, more power to you all. That is just not me. I was raised in the manner where women use their intelligence, they use their brain. We become professionals, whether it's a doctor, a lawyer, whatever. Truck driver, that's a career, because I'll be making, let me not even tell you all what we make a year. But anyway, my point is, that's how I was raised. So I'm not down in your game. Y'all do whatever y'all want to do. That's not affecting my life or my money, and that's all I care about. But I'm not down with that foolishness. Hey, Island girl, so you see what I'm talking about? She gonna tell you that she definitely knows what I'm talking about, what Island upbringing. Okay, so that BB, whatever, Bree Mims, whatever. I don't know who that heifer is, but from what somebody told me, she even had surgery yet, and she's literally licking the shit out of Disla ass. How are you a surgery coordinator for Disla? How are you kissing Disla's ass or licking her ass clean? Right? Riding hard for all who in the IG comments and on what do you call it, on these Facebook groups, and you never had surgery. So what kind of advice can you give somebody? You're a coordinator. You are booking people's surgery, and you have no first-hand experience to tell them, when you go to the DR, this is how the airport looks. This is what you're going to do. When you have your tummy tuck, this is what I want you to do. Guys, all of what I just said there and way more. When I book a client, I'm talking about my surgery consultancy. I am preparing you for every part of your journey. Before, during, and after. So these people who are calling themselves surgery coordinators never had no damn surgery, don't know nothing about the DR, and been there, but taking you all money. And you all so fucking dumb, you all giving them your all money. That makes sense? You're giving your money to somebody who have no damn experience. That makes sense to you all? But she been blocked from my IG a long time ago, because you only gotta come on my IG and make one fuck up comment and your ass will be blocked, and then you're gonna have to add my IG with your little fake page back again to get it. That's Tandra and Desenia story. When she died, they say she overdosed on painkillers. All their patients apparently overdose on painkillers. But let me tell you all something. I have right now, and I even saved it on my external hard drive. I have 3 videos right now that Desenia and Tandra don't know that somebody took off them while they were there in the recovery house laying down, and you all got to go run tell this and then his ass gonna be quaking in his damn boots. He was wearing black scrubs and lying down on one of the beds in the room, and him and Tandra is coaching one of the girls in the recovery house what they want her to say after this girl died. And I made sure and I saved it on my hard drive so I will never lose it from my phone. But when I'm ready, I will release it, because I'm still waiting on her to send her little raggedy ass countrified lawyer to send me some court case talking about cease and desist letter. I will never stop speaking about anybody that I think will be detrimental to any of y'all life and health. And if y'all still going to that man and letting that woman rob you all your damn money, then you get what you deserve. Because there's too many people on the internet, other groups and stuff, that are talking about what they've experienced with this man. Yep, they always blame the patient. It's always the patient's fault. He would never take responsibility for the foolishness that he does. Experimenting on women. Like one girl is in that group on Facebook, and her whole ankle, between her ankle and her knee, her calf is burnt. How do you get burnt there? Because this man was experimenting on her, talking about he going lipo her calf. You all ever hear what a doctor lipo in somebody's calf? So now her whole damn leg is burnt. Her calf. Big, red, raw, nasty wound. I can only imagine the scarring that's going to leave. Rosie, you could ask your doctor that question about going from a shelf to a slow booty. I can't answer that because I'm not a plastic surgeon. I don't know what techniques they use in the surgery room to shape your body or to reshape it. Wait, y'all say, oh, you know what? Mims, if you're watching the video, hi honey, I hope you post me up in your group so I can get some more followers for free with some free promo. The last time I think she posted my fresh out of surgery breast incisions, and then I had to shut her ass up by showing her how beautiful they healed. So yeah, I'm talking about you. Scheduled for surgery March 5th, but where she at, she's ghost. Probably don't have a passport. You horrible Miss Swiss. She just got her passport. So that tells you that this little dumb heifer is not even an international world traveler. So she can't even give you all advice on traveling through the airport, what to do. For example, people are always worried about, what am I going to do with all this money that I'm traveling with? What happens? So this little heifer never left America. Her ass, her whole 20-something years of life, been locked in the four corners of America. Never traveled to one country international. Just had to get a passport. Y'all fucking with me. Y'all stop lying in these damn comments. Y'all lying. Y'all oh, wow. Wow. Guys, I have been traveling. I used to work for Royal Caribbean, the cruise line, here in Miami at their head office for many years. I have seen 2/3 of the globe. Okay, I don't really talk about my past. People don't know what I used to do before, this, that, and the other. But when I give you guys advice about traveling internationally, because I've been traveling over 20 years internationally, all over the world, okay, to Europe, to the Caribbean, to Africa, to Australia, okay. So when I give you guys advice, it's because this is something I've experienced. Okay, yes, travel is not the same as it is now as it was back then, but every year I'm going somewhere international where I can experience what is the new rules that they have in the airport. Oh my God. Can you pay for your procedure while pregnant? You sure can, but most doctors want you to have your first surgery. A lot of them say on the safe side 1 year postpartum. Some will say 6 months, but majority of them, you know, the ones that are safe and want your well-being will tell you 1 year. Expensive doll. My private nurse gave me so much info while I was there And I feel like a lot of shit goes on over there that we will never know. Exactly. Exactly. But guess what? In the Surgery Bay Facebook group, you could come over there and spill the damn beans. Because I don't delete shit. I don't delete nothing. I want you all to tell people what the hell you all experience so that other people will not go through the bullshit. Scopa page, she took a ring longer and everything. And attached proof, but she has blocked me. Ring light to take her passport, bitch. Yo, don't make me laugh, okay? The girl is proud that she acquired her first passport, alright? My girl took a ring light to take her passport picture, alright? Alright. You're gonna have me dying here in these damn comments. Somebody said, is there a way you can request to be the first girl? Guys, send your questions here, please. That's the thing. You can ask the doctor, ask the assistant, the secretary, but there's no guarantee. And a lot of them will tell you what you want to hear. I'm talking about the famous doctors, okay, that have the 4 or 5 girls a day. When I had both surgeries with Dr. Laurent, I made sure and told, and that's why I also went down there a couple days before I even had my surgery. So every time I went down there and had surgery, I think I was there for 4 or 5 days prior, before the date that the actual surgery was booked. When I went down there, I told him, I was like, I want to have surgery, me and my husband and myself, the same day. I want you to do both of us. Of course, I want to be first because I'm the one with the more work to be done. And I want you to book us on a day that you have no patients at all. So that's how I ended up being doll number 1, and my husband and myself were the only 2 patients for the day, because I told them, whatever day of the week, I don't care, just let me know, and book us for that day where you have no other patients. I just want it to be 2 of us. I want you to be nice and, you know, refreshed from your sleep, whatever, so you're rested and you can do our surgery. That's what I did. Again, that's because I went to a doctor at the time who was not IG famous, who was a hidden gem, who was a local favorite. So the doctors I'm working with is the same thing. When you guys message me and all the people that I've been booking so far, you guys are getting the date you want, because they are not IG famous where they have 3, 4, 5, 6 girls every day that they're booked up. You know, so that's your chances now of being the only girl for the day, or even being the first girl for the day if it's just you and one other person. Only good I got off her page was finding you, no cap. Oh, she's posting me on her page. Yay! That means I'm famous. Because listen, if people are talking about me, that means I'm not surgery famous in the surgery community. So yes, just tell her to stroke my ego a little more. Make some post about me. Have you seen anybody get a Lipo 360 with a BBL that had weight loss surgery? If you have a bunch of loose skin from weight loss surgery, then it makes 0 sense for any doctor to give you Lipo 360 and BBL and leave you with all that loose skin. And like I was saying, no doctor is going to do that because they don't want you to have undesirable results and then go blame them and talk about what do you call it, that you're not happy with how you look. So that's why if you have loose skin, especially weight loss patients that need reconstructive surgery, a lot of doctors will tell you that no, you need a tummy tuck. They're not going to give you just Lipo 360 only. My doctor told me I'm the only girl for the day. See, I love that. Do you know anybody that had weight loss surgery and then got their body done? A lot of girls, but after weight loss surgery, they tell you to wait a year. A year for any plastic surgery because they want your weight to stabilize, and then reconstructive surgery. So if you have like a lot of loose skin on your inner thigh or arms that are loose, then you have a lot of like loose skin in your belly and your back, you're going to require more than one surgery because they're going to have to do a body lift now. So they may do tummy tuck, lipo, BBL, and do arm lift, and then you come back and then they do a back lift, thigh lift, and on your breast. So it will be, it is in phases that the doctor will have to do your body if you have a lot of loose skin because you had weight loss surgery. I told Mercedes I didn't believe there were only 2 of us on my date. Then he showed up in my room. When I woke up, I was like, I told you, LOL. Well, I don't know when you had surgery with Mercedes, but Mercedes' assistant said, and this was in November, she said this, we are fully booked all the way up until May. So what you can do is come down a week early and we can try and squeeze you in. Those were her exact words. So I don't know what you're talking about 2 in 1 day with Mercedes. Don't be out here trying to be on my life promoting Mercedes like he's so Mr. Wonderful, because he's shit in my book. And the reason why he's shit in my book is because how the hell are you booking 5 girls or more a day, right? And then giving people all kind of good results, bad results. Why? Because you're not the one doing all their surgery. And in the meantime, you're driving around on your little Maserati in the DR enjoying people's hard-earned money, and then they're not happy with the results because your ass didn't do it, your assistant do it. So Renard, please don't be in my comments making Mercedes sound like he's Mr. Wonderful, because he fucking ain't. He don't give a fuck about none of y'all. Just your damn $5,000. Ladies, ski, breast surgery, or any surgery after you're around 1, most doctors tell you 6 months. 6 months before you have a second round of surgery. And that depends on how you feel. Like I said, for me, after my tummy tuck, I was not feeling it. So I didn't have my surgery until like a year later. He doesn't do all their surgeries. Thank you, Dominican Dolly. If you would like me to block you from my live on my page, let me know. Because when you all start with these little catty ass comments in my comment thread, I'll be happy to pause the live and hide the live from you or block you from my page. You can go wherever you want elsewhere and get your surgery information. It's that simple. I don't play like that. Lady Ski said, where can I find your Amazon? Go to my profile, click on my name, it'll bring you to my profile. Click on the Linktree URL. It says Linktree on my profile right under where it says my WhatsApp number. And when you click on it, you'll see the Amazon store. You can click on that, it'll take you directly to Amazon, Facebook, YouTube. What else? What's your opinion on Duran? I just want to hear your opinion. My opinion would be a big fat laugh. Would you go to Colombia for surgery? No. And I said earlier I would never do surgery in Colombia. I've never been interested in surgery in Colombia because I feel like the famous doctors over there, because that's the only pages I've ever looked at is famous doctors in Colombia. They do not post brown women like me. They don't post black women on their pages. All I see is white women, Hispanic white women, Caucasian white women. So if you're not proud to post women that look like me on your page, then you're not worth me giving you my hard-earned money. I'm in between Moro and Sota. I'm gonna go meet them both. Don't get started on Duran again. I'm waiting a year for round 2. I bought all of my Amazon stuff from UA. Those dresses are the bomb. That dress is like $4 and like $2 on something in shipping. So $7 as you said per dress. I still have them. I have like about maybe eight different colors. I haven't worn them in a while, but I still have them. They're like a little stretchy cotton spandex material. They're not really super thick, like thick fabric, but what I like about it, it has the little sleeves. You can wear your faja under it, look cute, you know, dress it up, dress it down, and go out or go wherever, hang out, chill out, whatever, because you know you can't wear any tight clothes like jeans after your surgery in the beginning. So I like it for that reason. So those are some pretty decent dresses to get to take down there to the DR, because you know it's hot as hell down there too. Yeah guys, that Duran and that attitude, I'm sorry. There's too many doctors in the DR. hundreds of doctors literally, and I follow hundreds of doctors on Surgery Bay. A lot of them you all don't even never even heard their name. That will give you nice results. You again, depending on how you want to look after surgery. I mean, if you want a vixen look or you want a more natural look, somebody that's going to just better your body and make it look believable. There's a lot of doctors down there. There's doctors that give nice snatched vixen look. You just may either be too fat, so you need to have multiple rounds, or the dream body that you want just requires multiple surgeries to work on all those different areas. But there's too many doctors down there that do nice work for you guys to go to these women, Desla and Duran, that insult you all, talk down to you all, belittle to you all, have a stink attitude. My doll that went to Desla, for example, that woman had her in tears, crying during her consult. Right? Had her crying during her consult, because surgery is a very emotional journey. Right? So she had her crying during the consult, telling her all kind of stank shit. And this girl still had her surgery with her, ending up that the damn assistant is the one that did the surgery and not Desla. And I spoke about it the last live I did. How the hell do you do somebody's surgery Friday night? That's your last patient late in the night, and Saturday morning, 8 hours later, you don't remember what procedures you did to her. That tells me that you didn't do the surgery. That or you have some kind of crazy ass Alzheimer's where you don't remember nothing. Oh, you bought 5 dresses for surgery. All right. Fernando Ortega in Colombia, he posts black women. I'm gonna be real with you. I have zero interest of going to have surgery in Colombia, so I'm not even gonna check out his page, because why? I don't want to go to Colombia and have surgery. I love my DR family. I love everybody that I've met in the DR. Not just the team that I'm working with, but friends that I have that are Dominican, that live there, that have nothing to do with the surgery world. I love Dominican culture. I love the people. I love everybody that I've interacted with and come across. The majority of them, I like them. You know, so I would not change DR to go to Colombia ever to have surgery. And forget Miami. That's a joke by itself. You know, so I'm gonna be real. I'm not interested in surgery in Colombia. I'm not interested in finding out who does what in Colombia, because I have no interest in going over there. I'm in love with your before and after results. Would you recommend Laurent to go to him again if you wanted another round? Hell no. You guys that want to go to Laurent, I would say go to Laurent if it is that you want to set your foundation for round 1. And even that too, people are giving me feedback where they're not happy with their round 1 results from him, or their friends are not happy. But definitely attention to detail round 2 and 3 and 4. Hell no. Duran results are hit or miss now. So that also tells me that if her results are hit or miss, that means that she's so super busy that her assistant is now probably doing the damn surgery. Because how, if you're good at doing something, how suddenly do you forget how to do it? That people are now saying that they're getting hit or miss results from you. Lady Skiwi, no, you cannot book with me for recovery house and massages, because I am doing an all-inclusive package. I'm not doing mix and match and pick out whatever you want out of it. Nope, it's all or nothing. That's how surgery is. And it's not just the packages, it's all or nothing. Take me as I am or don't take me at all. This is what you get. Yep, Dominican Dolly said it. So many doctors, amazing doctors, it's crazy. A lot of them, you guys, you guys just know, some of you guys just know the top 15. The top 15 names that are constantly being called around in surgery groups and so forth. There is hundreds of doctors in Santo Domingo. Let's not even talk about Santiago, because I haven't even started looking into Santiago as yet. Marina said, give me a Vixen doctor, my BMI is 33. Off the top of my head, and I'm only calling the low-key doctors that I'm working with. Rami Mejia, Garrido, and Pedro, all of them, if you have a BMI of 30, could lipo the fuck out of you. Could lipo you nice and, what do you call it? That, you know, that lipo sculpting, how they do the torso nice and flat and they put the little lines, whatever in it. Go look at your work. Go look at your work. When you're done here, whenever click off, go and look at my page. Go look at the surgery packages. Click on the caption. Guys, I hate that. You guys, a lot of you guys are always asking me questions and the answer is in the caption. That means that you're just watching pictures like a damn 2-year-old. Every time I post something, there is always an explanation in the caption. I don't just post stuff with nothing behind it. There's always something written in the caption. When can I stop wearing the faja? I'm currently 2 months post-op from tummy tuck lipo BBL and start waist training. So do you want to get the best results, or do you want to follow the crowd and do what everybody is doing? Like the dumb shit, which is what I don't like. I'll be seeing some of y'all with this what? Rubbing Aquaphor or some shit on your belly, putting a plastic grocery bag on your waist, then a bunch of ace bandages, then some waist trainer, then your faja or some shit like that. Y'all crazy? Eh? Seriously? No, all of that is not needed. And I'm telling you, because I've had 2 rounds of surgery and lived in my faja and did not do all that madness, and I have a 27-inch waist. All you need is a good ass faja and consistency, meaning after tummy tuck, keep your ass in your faja 24/7 for 1 year. 1 year. The ab boards, you can stop wearing that if you want, 2.5, 3 months post-op. Seriously. If you want to do waist training, the only waist training I recommend is a steel-boned corset. Not all of that exercise waist trainer, waist cincher, or all of this. No. The real shit, the real deal that these women be using from long ago, before even plastic surgery days, to get their waist nice and small and tiny, is a steel-boned corset. So there's a website, and I'm pretty sure it's on my page. You all just need to scroll. It's called corsetdeal.com. The one that I like to recommend to you guys that don't have help to put on a corset is the one that has a zipper in the front, and in the back has the strings to pull it, to tighten it. Now, because it's a steel bone corset, it's very hard for you to sit with this on, because it doesn't really bend at the waist. When you sit with it on, you're going to be sitting like, your back is going to be like ramrod straight. So I think it's nicer to wear it to go to sleep at night when you're laying down. Now, the tighter you pull it, yeah, it's going to feel like your ass can't breathe. The faja is the same thing. You feel like you can't breathe. But that is what is required for you to get that tiny waist. So some people will start with the corset 4 hours, 6 hours, 8 hours a day, until they work their way up 10 hours, 12 hours a day. And you wear that consistently for a couple of months, you will be surprised. You will lose 3, 4, 5 inches on your waist from whatever you initially started at. And this is, my advice would be 3 months post-op. You can start still, because remember, you had a tummy tuck, and I'm telling you, wear your faja for a year. So you can start at 3 months post-op. You're just wearing your tank top with your faja over it. Then you put the corset on top of that, and you wear that overnight to sleep. Next morning you get up, I can guarantee you, you are going to be shocked at how flat your stomach is looking. So all this crazy shit these women be out there selling, buy my waist trainer set, buy my this, they're buying all these damn waist trainers from China and just getting their name put on it, and then telling you all do all this damn ace bandage and plastic bag and all this shit. All of that is not fucking required. Buy this caffeine gel and put it on. Buy this whatever and put it on. All of that shit is not required. Buy the avocado float. Buy the booty bean bag bed with the hole in the middle. Buy the anti-gravity chair and cut a hole for your butt. Buy pool noodles to sit on it when you're taking a poop on the toilet. All of this is shit, guys. It is not. You don't need to spend all that extra money to buy all this nonsense. Save that money and get some damn massages. That's what you really need. Duran busy drinking her coffee. Let me correct you, her tea. In her little what do you call it? Clickbait pictures with her little breasts showing. She in her bubble bath, taking out pictures and showing you all. A hot ass mess. Cabral prices have gone up. Hey, if you want the king of the Barbies to work on you, you gotta pay that, you know, $7,000 or whatever he's charging now. Couture Barbie in the making. As a bigger girl, I don't know who know. You gotta let yourself know that you will need multiple rounds if you are a big girl and you want a particular look. So it doesn't really matter who you go to for your first round. You know, you're still gonna need multiple rounds after that to get the look you want. For example, my BMI was 35 after I had my tummy tuck, right? Yes, I got a 27-inch waist after my tummy tuck and I got a nice flat stomach, but guess what? I still had fat under my sternum, under my breasts, on that upper part of the belly button, above the belly button. And I still had some fat in the fupa area. Why? Because any doctor who is worth their salt, any doctor who is a safe doctor, will not lipo the front part of your stomach, because if they do, they are going to destroy the tissue, the blood vessels, and more than likely you're gonna end up with necrosis, and that big ass flap of belly skin that they just lifted off your entire torso and your cavity of your body will turn black, necrotic, and die. Can you imagine having no skin in the whole front of your damn belly? How much skin graft they're gonna take from what part of your body to fix that? And what the hell they're gonna cost you? And how you gonna look after? So any doctor that tells you, yeah, it's a tummy tuck with 360 lipo, you better run far and fast. Because when you get a tummy tuck, the lipo is not 360. Any safe doctor will not do a 360 lipo on you. They will do lipo on your back and on your sides, which is called your flanks. But the front of your belly, they do not lipo that area. So that's why I had to go back for round 2 to get 360 lipo to get a nice super flat stomach that I wanted. And use that fat in my BBL to give me the bottom booty butt projection. So that's why some people need 2 rounds of a BBL. Because first round, you get what we call the foundation made. And the second round is to get projection. And now my third round of BBL is just going to be a little touch up to get some fat put on the sides that absorbed, and to get it reshaped. I want to get my lats down a little bit on the top there by my waist. I'm going to check out your packages. I need to return for surgery later this year. I plan on being in my Faha a whole year. That's what I did. After my tummy tuck, I was in my Faha for a full year. I only took that Faha off 1 week before surgery. Because my husband said, take your Faha off so that the doctor can see your body without the Faha. If there's any kind of swelling or whatever, he'll see it. And that's the only reason why I took my Faha off a week before my round 2 surgery. God knew I needed to watch this live, because now I know my Amazon cart is filled with nonsense. Oh my God, thank you for saying that. Listen, all the lists that is on Amazon, there's 4 lists. One is general supplies, which is you can get stuff for your incision, what do you call it? Your scar cream, the cicatricure cure, gauze and stuff to clean and dress your incision, your saline. There's hemo and vitamins, which is what you need to build your hemo. Even if you have a good hemo prior to surgery, you need to build your hemo back after surgery. So you need to buy hemo and vitamins to build back your blood. Then there's the luxury post-op stuff, like people who want to get a recliner or they want to get the leg massages and stuff. Things like that is in there. Then we have, what do you call it? Fashion, post up fashion. You guys always telling me, oh, I like what you're wearing, I like your outfit, whatever. So a lot of stuff I buy from Amazon is on there as well. And guys, those are not my prices. Everything that's priced there, I didn't add money to the price. Those are Amazon prices. All I did was add what do you call it? Add those, sorry, Chucker was taking me over. Add those items to the list. I didn't add anything. I didn't do anything with pricing. Those are Amazon prices. Everything I did was excuse me, was just add it to my list. Do you think everybody should bring $10,000 for surgery? No, because it depends on what you're getting. Let's say you're getting okay, my example. Let's say you're getting you purchased from me the tummy tuck lipo BBL package. That's $7,000, right? The only other extra expense you would have in the DR besides that $7,000 is if you need a blood transfusion, if you want to get the pain pump, $25 every time you alter your faha. If you want to go and do extra stuff like your nails, your hair, go to the mall, go shopping, go out to eat in a restaurant, whatever. Tips for the people that took care of you. What else? And your medication, which is your blood thinner shots, your antibiotics. The only reason I did not include that in the package is because the doctor is charging $300 and it's cheaper if you go to the pharmacy on your way back from doing your labs with your driver, with Sigfrido. So that's going to save you at least $100, $150. So I didn't think it was worth paying $300 for antibiotics, blood thinner shots, and then some damn iron, vitamin C, vitamin E capsules. But that's it. So what I just said there is definitely not $3,000 that you need to take $10,000 with you. And actually, sorry, $6,000 because the $1,000 deposit goes towards the $7,000 package. So that's definitely not $4,000 worth of items. So it depends on what kind of package you have, what kind of surgery you're getting. If you're doing add-ons, like you're getting, you know, more stuff done to you, or you're going down there and you're gonna do your teeth, you're gonna do, I don't know, whatever other surgery, chin lipo with your doctor, whatever. Not talking about my package now, talking about whatever doctor you go to, because these doctors, as far as I heard, are charging $600, $800 extra just for like chin lipo. My doctor is charging $200 because that's the price I told him I wanted him to charge. Will you agree to this price? All my doctors said yes. So when people are telling you stuff about, you can get it cheaper, don't take her package, go and get it cheaper, go yourself, yeah? Well, let me see you get $200 for chin lipo, or $300 for arm lipo, or thigh lipo. Tell me which doctor is giving you that price. They're gonna laugh in your damn face. Have you decided on a doctor for your wrong tree? No. Earlier, and I think yesterday, whenever I did the last live, I said that I'm not gonna decide on who I'm going to until I see all the doctors that I like, see them in person to get an in-person consult. Marina said I want to leave and go back to your Amazon list, but I don't want to miss anything. Amazon is always there. The live ain't gonna be there because I don't think I'm saving this one to put on YouTube. What vitamins should you stop taking before surgery? Good question. Anything that has a blood thinner in it, which is vitamin E, turmeric, ginger, if you're on diet pills, phentermine, whatever else diet pills you might be on, all those are a no-no. You need to stop that at least 2 weeks prior to surgery, because you don't want anything having your blood thin. Aspirin as well. The reason why is because you don't want to bleed out during surgery. Then they're going to have to stop your surgery short. You're not going to be happy with your results because then the doctor wasn't aggressive. So that's the reason why you need to stop taking anything that has blood thinner in it. Thanks for representing the truth. Always, guys. This is my father coming out in me. This is how he raised me. This is the impact that he had on me from a young child. People may not like what you want to hear, But that doesn't mean that you should follow the crowd and do what everybody else is doing. You know what I'm saying? So who don't like it? Like I said before, when I got that cease and desist letter, the only way I'm gonna shut up is somebody gonna have to take my ass to court, and the judge gonna have to tell me, shut your damn mouth or I'm gonna put you in jail. Because y'all know I ain't set up for jail. Come on now. I'm too soft. but yeah, seriously. And I swear to y'all, when I post something, it's because I know it's gonna help somebody in some form or fashion in their life, something that they may be going through, or to help prevent them from going through some bullshit. Because let me tell you guys something. I was on a bunch of Facebook groups, and when I had my surgery January of 2018, I think it was April or May. No, May, because it was Memorial Weekend. May of 2018, I just got off Facebook. And I only got back on Facebook because I started the Surgery Bay Facebook group. That's the only reason why I got back on Facebook, which was last year. I was off Facebook for all that time because I was just so fed up. All them toxic ass women in there, always arguing, fighting, quarreling, talking some shit, saying something to somebody about something. Like I had enough. And I just left a lot of the groups, left Facebook in general on the whole. I wasn't on Facebook for like 2 years. So that's one thing, you know, that when it comes to speaking the truth and helping somebody, I will always do that. Because when I was in those Facebook groups getting myself ready for surgery, and after surgery, like when I had my my leaking belly button, nobody would give me help. All these so-called vets, the vets that are in those groups talking about, yeah, I had these surgeries, that surgeries. Well, why are you not giving people advice and helping them when they ask a question? You just want to be in there, I don't know, to feel important. That people are like, oh, I trust what she says because she's been through it, whatever. But when people really need help, you're not answering them. Why? Like one lady told me, she went to Mannion. Yeah, I had a leaking belly button. And I messaged her. I messaged her on Facebook Messenger, and I was like, "Can you tell me what you did to get it to stop?" Okay, I'll call you when I get off of work. Crickets. Always in the people Facebook group. Never called me, never answered me, never told me what I could do to stop that. Why? I don't understand that. I don't understand giving somebody information, sharing knowledge. How is that taken away from my life? I don't understand some of y'all. Seriously, y'all were raised real fucking different. What are reasonable tips to leave? My thing with tipping is do not tip until you're leaving. You don't have to tip people at the recovery house or the driver or the nurse at the recovery house every time they help you with something. No. If you truly are giving me good service, good customer service, then me giving you a tip or not should not make a difference in regards to if I get better service, good service, or bad service. So based on how I was treated for my entire trip will determine how much I give you as a tip at the end. So people like the nurses at the recovery house, guys, I know you all mean well. You all want to take bath and body lotion for people, perfume for people, whatever else you'll be buying, candles. People in the DR who do these jobs are poor people, okay? They're not making no big money. Yes, they'll be happy they got some Bed Bath and Beyond lotion, because I'm pretty sure that's something they will not buy themselves normally because of how expensive it is down there. But they will appreciate money more as a tip. They will appreciate you giving them $50 or $100 when you're leaving than giving them some candles and some perfume. So I feel like the people that you want to tip are the people that directly helped you, which is the nurses at the recovery house. John, my masseuse, I know John does not take tips from people. He tells you, say a prayer for him, and that's all the blessings that he needs. The driver, if you want to tip them when you're leaving, you know, $25, $50, whatever, because they already got their payment when you paid for your package with them, that's a nice tip too. But beyond those people who are directly helping you, it's up to you. If you want to take something for your doctor, if you want to take something for your doctor's assistant, if you want to take something, give a little tip to the man at Cipla who helps you into the car, who opens the door for you. These are like the little valet guys. If you want to give them a little, I don't know, $5 US dollar tip, that's up to you. But the people that are really having an impact on your life, which is really the nurse and your masseuse and your driver, and I mean your driver to some degree, but not really even the driver so much, really your nurse. That's who you really want to tip. Thank you. I love your Amazon page. It's super organized. I bought the Maple Life Vegan Iron Tonic 2 days ago, and I can't wait to try it. Thank you. There's definitely a lot of toxicity in this community. And you know, I made that video the other day and I put it on YouTube about women having plastic surgery for the wrong reasons. You know, and a lot of you guys, myself included, because I have childhood trauma, are having plastic surgery thinking that it's going to make you happier mentally and internally, and it doesn't. It doesn't. Some of you guys get even more of a stink attitude when you get that banging body. That's not cool at all. You know what I'm saying? So some of you guys that are having this surgery thinking that you're going to be happier, so you're going to be in a better mood, or you're going to treat people better, or you're going to behave nicer, or you're going to react differently to situations, you all need, seriously, some professional help to work through whatever demons, whatever baggage, whatever you have going on, you know, internally, whether it's before or after surgery, to work that out, because plastic surgery is not going to fix that. What do you do for a leaking belly button? My friend is going through that. Tell your friend she's going to have to purchase that from my website. Sorry. Seriously, it is what it is. I've been giving so much information away for free for so damn long that the reason why I deleted all my shit off my damn Instagram, like 700 posts, 400 tips in my highlights, is because I was literally fed up and tired of people who talk shit about me, using my information, my helpful knowledge, and then instead of being thankful and saying thanks, Surgery B, no, let me go and make fun of you, bad talk you, say shit about you on my Instagram or on my Facebook. That's the reason why. So people who are really interested in their journey, in their health, in their well-being, just like you invest in high school education or in college education, sorry, so you can get a degree and get a better job and have a better life, is the same way you would want to invest in your health and well-being after you have plastic surgery. The same way you're investing in massages and fahas, because that's part of plastic surgery, is the same way you would invest in buying my knowledge. It is what it is. Is your driver connected to the recovery house? I don't understand that question. What do you mean connected to the recovery house? My nurse keeps telling me she won't take my tips either. I'm still going to slip some in her pocket. I don't care. I wasn't raised like that. Exactly. Exactly. I do that shit too. I be like sticking stuff in people's pocket. Nope, nope, nope. Here, this is for you. Be mad. Like when I was in the DR in December in Santo Domingo, you guys that saw my trip to the DR on my personal Instagram, because I had put everything in the highlights and in the IG stories. We were at this one, my friend from La Vega, we were at his friend's house. So the mom, we were there I think for 2 nights, and every morning the mom made breakfast and stuff for us. And when we were leaving, I told my friend, I was like, I mean, because guys, believe it or not, no matter how poor people are in the DR, because the lady and one of her daughters, or 2 of her daughters, weren't working, and one of the husband and her son was working, so I think that's who really, you know, brought money to the house. So I told my friend, I was like, I want to leave her some money, because, you know, she didn't have to get up early in the morning, make breakfast for us, cook during the day for us, you know, whatever. She didn't have to bring us, let her stay at her house in the night. None of that. We use water, we use electricity, whatever. So he was like, no, she's not gonna take money from you. And I was like, So what do you want me to do? He was like, that's how she is. She said she's not going to take money from you. And I'm like, okay, I got something for her. So what did I do? When I was leaving, I gave the money to her daughter. And I said, this is for your mom. But when I leave, give it to her after. You know. So sometimes you got to do slick shit like that. You got to put it in a little, whatever, card and tell them, here, I just got you a card to tell you how much I appreciate what you did for me, whatever. But don't open it until I leave or whatever, and then there's money in there, you know. So you gotta be slick sometimes, because some people, you know, they're just like that. They are happy. They are happy to provide a service to you and take care of you because they're that nurturing, because they're that thankful. Somebody said you can't lipo your soul. That's so damn true. Yep, screenshotting it and using it as their own. Y'all know how it is now. I mean, how hard is it to say, I learned this from Surgery Bay? Guys, go follow her. She gave some good information. How hard is it to say that? I don't understand. What is this mentality, yo? Like, y'all laugh when I said earlier, who raised these people if roaches raised them? Because human beings didn't raise them. That selfish, greedy mentality, I will never understand that. I was not raised like, and I'm an only child. You would think I'm selfish. You would think I'm selfish, I'm spoiled, I'm, you know, prissy or whatever. I'm the one that's only child for both my parents. And I'm the first one to take the shirt off my back and give it to you. Literally. I was at my my job, my terminal, a couple months ago. I had on some earrings. I think they were shaped like the continent of Africa, and they had like the little whatever writing on it, whatever, with the Jamaican colors, the Rastafarian colors. The one lady in the cafeteria, she was like, oh my god, your earrings are so beautiful, where'd you get them? I want to get some like those. I said, you like them? Here. And I gave them to her. I took them off my ears and I gave them to her. What did it cost me to give this lady some $5 pair of earrings? How much joy did that bring her? You know, yeah, I like the earrings too, but am I gonna die because I don't have my earrings to wear anymore? So guys, when I tell you all about positivity and the universe and what you put out there is what you get back, it comes back to you in so many different areas. I gave her those earrings. That doesn't mean that somebody's gonna give me, you know, a shirt or a pair of shoes or whatever. No, that just means that I put positivity in the universe, and some way, someday, sometime in my life, I might need something, and somebody is gonna come there and help me with it. Look at my dog. I really thought that we were gonna have to put my dog to sleep, that she was gonna die. I really thought so. Like, she was so sick when I came back from surgery, from the DR, leaving her for 3 weeks. But she is like back to her old self now. Back to her old self. Look, she's in her bed right now with her teddy laying on top of her head. You know, her little personality is back. She is back. She's back to how she used to be. Why? Because I strongly believe all that positivity that I try to put into the universe on a daily basis came right back to me in the form of my vet was able to save my dog's life, and she recovered and bounced back like nothing. Love T. So Sigfrido, who is the driver on my team, he works with the recovery house in the sense that he picks up patients from there and so forth. But Butterfly Recovery House has their own driver called Robinson, and that's who, if you book Butterfly Recovery House and you already paid them, for massages and for transportation, Robinson would be the one picking you up and dropping you off and so forth. So Sigfrido, my driver, yes, he comes to Butterfly. He was there in December at the house when I was there also. He comes there and drops and picks off people if you hire him separately. You didn't take Butterfly transportation. When do you suggest paying our nurse? Should I pay her at the end of every visit or weekly? Are you talking about nurse in the recovery house or nurse in the Airbnb? Because nurse in the recovery house, you would pay the tip to her at the end of your stay. Overnight nurse, you would pay her a tip if you want the next morning when you're being released from surgery. And then nurse in the Airbnb, I would pay her the beginning of the stay. I would pay her when she gets there, and then if you want to tip her, pay her at the end. Showing love is free. Damn right, girl. Giving credit where it is due is seriously lacking in this community. It's insane. Yup. Skin said such a Caribbean queen. Guys, I know I can't hide my accent. Living in America over 20 years and people hear me, they're like, somebody said Guyanese earlier. No, I'm Trinidadian. I remember you mentioning it before Valentine's Day. I was afraid to ask you when I heard coughing in the back. I am so happy for you. Yes, so that was my baby. That was what was going on with her. With that, I came back and the vet diagnosed her with congenital heart disease. Mind you, she just had a full checkup in November, and me coming back from the DR January 4th, this is what I'm told. She had full blood work. All her blood work was perfect. She didn't have any cholesterol, diabetes, none of the stuff that other dogs suffer with. Even now, when he did her lab work just before he did her surgery for Valentine's, her numbers were great. He said the only thing was her kidney was a little high, but he think that was because of the infection that she was dealing with at the time. But she had what they call it's called pyometra, and it's where when you don't spade your dog, small dogs, they get this infection in their uterus, and they have to literally remove, like spading, remove the entire uterus. But what also happened to her was she had, besides the pyometra, and I think that's what caused this to happen, she had vaginal dysplasia, where we were in Nebraska, 20 degrees or 13 degrees or something in the night, and my husband take her out to pee, and when she came back from peeing, I wipe my dog's vagina and butt with a baby wipe every time she used the bathroom. So when I go to wipe her, I see this piece of flesh hanging out her vagina. I'm like, what? WTF? And I like poke it with the baby wipe like that, like to kind of stick it back in her. Guys, let me tell you how I freaked the hell out. That was the beginning of the downfall of her health. Besides, she already had the damn congenital heart disease diagnosis in January when I came back January 4th from the DR. So now this is the end of January, I think is when this happened. Or was it February the 3rd or something like that this happened. So now I'm thinking, oh my God, my dog is going to freaking die. Like, this piece of flesh is going to turn necrotic, and it started turning dark red black. And we're trying in the meantime to get a load to get down to Florida. We're in Nebraska. Florida is I don't know how many friggin' 1,000 miles away. We had to go all over the country, then to California, from California back to somewhere in the East Coast, and then from there got a load to come down to Miami, because I didn't want to take her to any other vet. This vet has been her vet since she was a baby, since I had her at 2 months old. So anyway, he told, I had antibiotics in my truck. Guys, if you guys don't keep antibiotics in your household, that's something that you need to get. Or keep some form of antibiotics in your household at all times. I had some Clavamox that the vet had given me for her like last year sometime, because she had a cough, not even knowing that the damn cough is related to the heart. But anyway, and I gave that to her. She had 10 days worth of antibiotics, and after day 10, day 11, we got down to Florida, and the same day he did the surgery on her. And when I looked up online, they were like, usually a dog will die within like 4 days of having this issue. I asked the vet, I was like, oh my God, how did she survive this? And he was like, because you gave her the antibiotics. He was like, I really think that the antibiotics is what really helped save her life, because this infection was really severe. So when he took pictures of the surgery and stuff and all of that, he told us, he said she has a 50-50 chance of living or dying because of her heart. She could probably pass away during the procedure. And he told me that he was gonna give her for the anesthesia, not like a IV drip kind of anesthesia, but like a gas. And she survived it. She survived the surgery. Literally the first night, well, the same day, Monday, when we took her to the vet and she had surgery, because Sunday was Valentine's, She slept all night. She didn't eat anything. She got up and drank water. She got up from her bed, drank water. Day 2, my girl was eating. Day 3, she was pooping. Because you guys know, same thing with humans and surgery. You know, having anesthesia and stuff, you get constipated. You know, so now she's back to her old self. You know, God willing, she has a lot more, what do you call it? Life in her. A lot more years to live, I hope. Toy poodles, their life expectancy is 14 years. She's going to be 12 years this year. And some people have told me that their poodles have lived 18, 19 years old. So fingers crossed. If you guys don't know, I am very strict with my dog. She only drinks alkaline water. She only eats organic food and organic kibbles and snacks. Like, I don't play when it comes to her. I treat her, my husband he's always making joke and saying, I swear you treat this dog better than me. This dog be having all these snacks and whatever. Like, you know, I don't even get this good treatment. So that's my baby, guys. You guys know I had a hysterectomy. You know, I cannot carry a human child. My gynecologist told me, yeah, you can still have a baby, just, you know, you still have your eggs, you can do in vitro, whatever, use a surrogate. But I don't know, really know if that's in the cards for me to have a human child. But I am very much open to adoption. You know, Caribbean men, my husband wants to have a genetic child, so we'll see when that time comes, if the universe has that in the cards for me. So let me see what else you guys are saying. Let me read these questions you guys have. The first question is, what are some tips for having a tummy tuck and BBL combo? Weighing your faha to shape your body, feeding the fat so you can get a big butt if that's what you want, and making sure that you get all that fluid out from your belly, your fupa area, because that, you don't want your incision to bust open. True story, one of my Miami clients, she's an older lady, she went to, I remember the doctor, forget the doctor name, in Miami, had a tummy tuck, Lipo BBL. I had my hysterectomy in October, and actually I had my hysterectomy on John's birthday, my masseuse. Went to Miami to recuperate for 10 days. So while I was down there, she had her surgery, and you know, I make the ginger turmeric tea to drink after surgery. Any kind of surgery, I drink that, because if you guys don't know about the health benefits of turmeric and ginger when it comes to blood clots and inflammation and stuff, Google it. It's very good. It's a Caribbean thing. Like in Trinidad, we always drink, especially women that give birth to children. Of course, you're giving birth to children, right? After you give birth, they always make turmeric tea and have them drink it. Anyway, I made a whole picture and I took it to her. She's there in the hospital, in the hotel or whatever, with her nurse, some girl she hired to be with her. She's in this big ass faha, very loose. Oh my God, I'm in so much pain. Okay, but you gotta wear the faha. It's gonna help you. Didn't listen to me. This lady is not even my size. She's more petite, and they have her in a 4 XL faha that has not been altered in the waist. It's the off the rack size faha. Come on now, ma'am. Anyway, she don't want to listen to me. She went back to New York where she lives. I think she lives upstate New York. She did not have a spa or a masseuse to go to get her massages. She hired some friend, because she's a doula. She hired some friend who is a masseuse to give her massages. And I ain't got nothing against white people, because white people could probably be good ass lymphatic massage therapists too. But she hired this white lady who is not a licensed lymphatic therapist, that doing I don't know what the hell to her, not listening to me, not wearing the faja super tight like I told her to get that inflammation down. And guess what happened to her? Like I told her it would, and she didn't listen, and then expect me to help her fix the problem. Well, ma'am, I don't know how to fix the problem, because the problem wouldn't have happened if you had listened to me in the first damn place. Her tummy tuck incision busted open because the fluid had to find a way to get out of her body. Her tummy tuck incision busted open on the side, and of course it started a raw wound, and so much fluid was pouring out of it. This lady had to start putting a diaper to catch all that fluid that was coming out even after she got out from the damn shower. You hear what I'm saying? A diaper. So finally she started going to one of the I think it was Plasti Muñecas too in New York. She finally started taking a damn cab or whatever and going down there to get her massages. She finally got herself into a tighter faja, and then the healing process started. So guys, when I tell you all to do something, I'm not saying do it because I just pull it out my ass. Do it because it will help prevent other issues from happening like that. Because when you keep all that fluid in you, not just did she have now that issue to heal the raw wound, get the fluid out, you also got to worry about, will you catch an infection? Will you catch an infection where you're going to get now hospitalized, they're going to tell you you have cellulitis, then they're going to put a wound back in there and open up your tummy tuck, and then you might have an ugly ass scar that you're going to heal with. So wearing your faja tight, getting that fluid out your fupa area, getting massages from a licensed person who know what they're doing is imperative after surgery, and that's where you spend the most money. Not just your surgery cost, but the post-op care and the materials that come with it is where you spend the most money. I'm reading your comments, hold on. You want to do IVF? Girl, that man and this, like I said, this Caribbean men with you with these genetic babies, and adoption will only be a secondary thought process. What about training your waist as you work out? First of all, you don't want to start working out too early if you have a tummy tuck. If you had lipo, you can probably start working out after a month. If you had a tummy tuck, at least 2 months or more. Whatever you guys do when you're working out, if you want to work out in your faja, that's why you need multiple fajas, so that you can have a clean one every day to wear. Or if you want to take your faja off and put on a waist trainer and work out in that. But the waist trainer, they always recommend you don't start that until 3 months post-op. Let me see what else you guys are asking. A lot of people don't recommend Dr. P because of his attitude. But does he deliver safe? And then the rest of it cut off. It's not telling me does he deliver safe. I don't know what the rest of it is. Guys, go. Dr. P, Patrick St. Louis, is another Haitian doctor in Cibla. If you guys don't know, he's Dr. Lawrence's buddy. I don't know if he trained with Dr. Lawrence or not, but I definitely know for a fact that he has helped Dr. Lawrence in some of the surgeries that Dr. Lawrence did, which were like long surgeries, the ones that you're doing like on weight loss patients, so there's a lot of skin and stuff to remove. The people, what do you call it? The streets are saying, let me say it like that. The streets are saying that people are unhappy with their results. They're unhappy with his customer service. They're unhappy because he's ignoring them on the phone. Something about people are getting infections. I don't know. He's never been a doctor that I've been interested in. He's a doctor I will never be interested in. So I don't know. I really don't know if all of that is true or people are lying on him. So I can't say. Can we do your packages with our own choice, doctor? Because I've been researching for a, and then the rest cut off. No. Like I said earlier, the package is all inclusive. Take it or leave it. There is no mix or match. I've heard Dr. P's a hit or miss. So one of my customers went down to him in December, actually, while I was down there, and had surgery with him. She told me that this was her experience. She actually was going to go to UCBU, and UCBU assistant Wendy fucked it up for him. I don't know all what bullshit she was doing with my client while my client was down there, and give her a whole runaround, and I don't know all what else she did. And that's why my client say, you know what, F this, I'm going to go across the hall, well, to the 5th floor, and go to Dr. Patrick. Went to Dr. Patrick. She said, my client is Black American. She's Muslim, so she had her head tied. She said that when she went there, the receptionist was like, okay, Dr. P will come and give you the consult, whatever, in a minute. And then some other woman came in, and he totally ignored my client who was there waiting for him first. Tended to the other people, was, I guess, chit-chatting, laughing it up, doing whatever with them. And she felt kind of slighted because she felt like, he was doing all of that with them. And why did I not get that same happy, cheerful, attitude or whatever behavior? You know what I'm saying? So she also said that about Wendy, Dr. UCBU's assistant, and I experienced that myself. When we went down there, they're on the 2nd floor, UCBU. When I went to his office, she told me that and she speaks Spanish, by the way. She speaks about 50% fluent Spanish, that she could hold a conversation. My ass can't. I can't even hold a conversation. I can only tell you words and phrases in Spanish. She said that she felt like Wendy, UCBU's assistant, was acting kind of racist towards her because she's black and she's not Hispanic or Latino, whatever. When I spoke to Dr. UCBU's assistant, I felt that too. But I felt that she was acting racist because I look Dominican, because I wasn't Spanish and I wasn't speaking in Spanish and I wasn't answering her with a Hispanic accent or whatever like that. So I felt that way as well. So I left his office, walked out, and that was like fuck that. She made it bad for him. So I haven't told him as yet in WhatsApp what I experienced, how I felt, and she's making it bad for him as a surgeon because a lot of people are complaining about her in his Facebook group. But one day, when I'm ready, I will be sending him a voice note and telling him I came to see you and this is what I experienced. And then, it was, you can feel the vibe. If you guys trust your intuition and trust your sixth sense or your third eye or whatever, you will feel the vibe with somebody and will let you know if this person is for you or not. So my client had Dr. P do her surgery. I think she said that her hips are gone, that the hips that he gave her are gone and didn't stay. She's not a big person. She had a nice BMI. She was, I would say, like medium built, kind of slim. So her waist right now, after having surgery in the last week of December, her waist now is like 30 inches because she wears her faja nice and tight, and she also knows how to alter her faja, so she alters it to keep it nice and tight. But beyond that, where she also felt like she would message him and he would ignore her. Oh yeah, because she had an issue with her legs were swelling really bad, and the compression socks that she had, they were telling her that the compression socks is the wrong size. And whenever she would message him and let him know what was going on with her and how she felt and whatever, she felt like he was ignoring her. He didn't, tell her, okay, I'll come see you at your recovery house, or didn't tell her, okay, come to the office, whatever. So she also felt like it was not, a good experience in that sense. She was expecting, I guess, a lot more out of him customer service wise or one-on-one attention wise, whatever, and she don't felt like he delivered. So that's what she said firsthand. But that's the only customer I've had that's went to him. And don't spend a damn dime on bad vibes. That's what I'm telling you all. I'm telling you all, like, there's too many doctors. Too many doctors. Okay, for example, there's a doctor, Julio Guillermo is his name. I had posted this in my IG stories a couple weeks ago. And the question was, who are the 3 OG doctors that made surgery in the DR famous by going to New York to the Dominican hair salons and doing their consultation with women at the Dominican hair salon and doing the bodies of the Dominican hair salon workers, owners, employees. A lot of you guys answered Cabral, of course. Some of you guys answered Abreu, which is the owner of CSIP. But the answer was Cabral, Contreras, and Guillermo. When you go to Guillermo's Instagram, like somebody was saying earlier in my IG stories, when she said that the doctor Instagram looks like trash compared to other doctors, Guillermo, his Instagram, I think he has like 17,000 followers. His Instagram has a lot of pictures of him doing surgery, him talking about, you know, whatever doctor stuff, but it doesn't have a lot of pictures of his work. Now here's the thing, if you don't know this man, if you've never had surgery with him or know somebody that had surgery with him, or know about him because, you know, you have the DR Connect, you would think by looking at his IG like, his work look alright, but it's not wow, I'm not gonna go to him. Let me tell you, my friend, her sister, I think she left the DR by now. She was down there like in the last 2 weeks. Had surgery with him. She had surgery with him 17 years ago, because she had a son 17 years ago, had a tummy tuck, and then recently she just had a daughter, so she went back for another tummy tuck. My friend is telling me how for 17 years between children, her sister results was bomb. That her sister, even after giving birth and having been pregnant, had a small belly, she carried small whatever, because she didn't really have what do you call it, the muscle repair remained good for so long that she didn't have a big belly because the abdominal muscles separated. And she went back to him, her doctor, because that's who did her surgery all those years ago. My friend is Colombian Haitian, and her mom ran a very successful surgery spa or post-op spa in New York for, I don't know, probably 20, 30 years, something like that. So she told me, she was like, when she said his name, I'm like, his name don't sound familiar, let me go look him up. And when I saw who it was, and when she told me about the story about him and her sister and whatever, she was like, a lot of people don't know about this man. You know, all they know about is the top 10, 15, 20 plastic surgeons that, you know, we see circulating on Facebook and on Instagram, you know, with these different doctors. So that goes to show that a lot of these unknowns that you guys haven't heard about, they may be very skilled doctors that's been practicing for 25 years, whatever, but again, following the crowd, following what everybody's doing, following the, what do you call it, being a sheeple, right? Being a sheeple. I want to go to Tesla, I want to go to Duran, I want to go to Mercedes, I want to go to Guidicelli, I want to go to Cabral, I want to go to Datsenia, I want to go to Bello, because that's the names that you guys see people talking about on the internet. You guys didn't do any research, didn't ask if you have Dominican friends or you know anybody, you know, who's from the DR or whatever, for information on, so who's the local favorite? Who down there people like? Who do these people go to? Like, because do you guys think that when you guys get these quotes from these doctors that you're getting the local Dominican price? No. You are getting you're a tourist bringing greenback American dollars price. Greenback we call it because the US dollar is green and white. So if you guys don't know, when I went down there in 2018 for my first surgery, the pesos were $1 to 49 pesos. Now it's $1 to 59 pesos. That's what I got when I went down there in December. But I went to a mom and pop cambio that gave me 59 to 1. I think a lot of people were given 57 point something, 58, right? So think about why these doctors are asking you all these big ass money for US dollars. Because the US dollar goes longer than getting the Dominican pesos. And still they're giving a cheaper price to their local Dominican countrymen and not to you, the tourists. So when people tell me, well, I can't find no information about your doctor on Real Self. Hello, is Real Self a Dominican website? Or is that an American website? There are a lot of doctors that are not on Real Self. If I'm giving you these particular doctors who are local favorites, of course you're not going to find them on Real Self or on Google or on whatever, wherever you're looking for information. Because they're local favorites. That's why there's not a lot of information out there for you that's on the internet, right? When I tell you I'm getting you chin lipo for $200, right? $200 I'm getting you chin lipo for. Your doctors are charging Bello charged one lady $2,100 just for chin lipo. You hear what the fuck I said? And the lady is Dominican that lives in New York. And charge her $2,100 for chin lipo alone. That was the only procedure she went down there for. These doctors are charging you all $600-800 for chin lipo. I told you that I am getting the Dominican price for my people for you all. $200 for chin lipo. So when people are in my inbox and in my comments, whatever, telling me I can't find so and so, that's why. That's why. That's why. And like I said earlier in the live, when I told you all that I pay the same damn price you all pay for massages, for me and my husband with John, I pay the same price you all pay for overnight nurse with my overnight nurse, $100. Okay? Well, we rent a car, so we don't have a driver. But whatever price you guys pay for stuff, I pay that too. I'm not gonna go down there and be like, oh, do you know who I am? I run this surgery blog. I run this I'm a surgery community influencer. I'm this, that, and the other. So I need some what do you call it? Some discount or some free stuff, whatever, and I'm gonna promote you. Excuse me? So these people don't have families to feed, they don't have bills to pay? I'm not gonna do that. I'm not gonna go down there and be like, you know who I am? So make sure you don't burn me or whatever kind of bullshit. No. That's some ghetto ratchet shit. I'm sorry. That's some ratchet ass shit telling a doctor, you know who I am? So I want some discounted stuff or I want some free stuff. People have families to feed the same damn way. One of my doctors, I was talking to him one Saturday. I was in California. I had good ass signal. We were video talking. He was at home, sitting at his dining room table. His son was there coming into the video while I'm chatting with him. His wife came in the video to give the baby, he had a toddler, to give him his bottle. Came in the video to get the son from his arms, whatever. These people have regular lives. They have bills to pay. They have whatever that they're doing also, just like the rest of us. So the same way I value my career, my job, what I do, whatever, is the same way we have to, as Americans, go down there and value these people, what they're doing. They're cleaning the shit out of your ass. Literally. Literally, not figuratively. Literally. Some of you all be having surgery and be shitting on yourself. My nurse Elaine, right? I had bought her some little fuzzy bedroom slippers. Or shoes, I should say, like little bedroom shoes. They sell them at Walmart. They were like, what is it, $5.97? It's the ones that they slip on. They're like kind of like socks, but they're like a thicker material. They got the little rubber thing on the sole so you don't slip. So she loved those because I brought those with me to the DR when I went for surgery. So I'm like, I'm gonna get you some next time I'm coming back. She told me. One girl, she was the overnight nurse for the girl after surgery. She shit on the shoes, so I had to throw them away. This time when I went, I bought her like 3 pairs. So she always gonna have a pair, right? These people down there are literally cleaning some of y'all shit, literally. Your vomit, your pee, you're pissing on yourself, you're pissing in the bed, you're pissing all over the faha, you couldn't make it to the bathroom, you know? You think I could do a job like that? Hell to the no. I'm scornful. I'm sorry, I'm scornful. I am scornful of other people's bodily fluids. I don't like to be in crowds because I don't want nobody who's sweaty touching me. You know, so I cannot do a job like that. These people are literally doing stuff like that. And then for me to hear people go down there with these ghetto-ass behavior, cussing them, quarreling, shouting at them, screaming, acting the fool, whatever, trying to rob these people because you all don't want to pay them the damn $20 or whatever it is you owe them. That just kind of tells me the kind of people that some of you all are. And that's why shit would not go good in your life. Because sometime or the other, it's going to come back to you and it's going to come back worse. You know what I'm saying? So no, guys. You want to tip these people that are taking good care of you. I'm not saying tip everybody if you get shitty service. I'm saying if they gave you good service, they were good to you, they cleaned your damn bodily fluids and your poop and whatever, they made sure you were comfortable, you were fed, you were nice and clean and fresh, do the decent, honest thing and give them a damn monetary tip. Because they don't work for a lot of money. They really don't. If I'm not mistaken, I heard, I don't know how true this is that a lot of these nurses that work in the recovery houses, their salary is something like $25 US a day. Yes, some things are cheap in the DR, like if you go to the grocery or the supermarket, you go to the market and you go buy your own meat and vegetables to cook at home. Yes, some things are somewhat cheap in that sense. But rent and all this other kind of stuff is still expensive compared to the money that these people make over there. The cost of living and the money that they make, their salaries don't add up. But anyway, you all know who you all are. I could never treat people like that. I'm sorry. Hey, mama. You need me to stop so you can use the bathroom? My baby girl. So anyway, guys. So I don't see any more questions in the question box. We talked about so much tonight. Please save this live and or upload it to YouTube. I'm at work. Girl, I wasn't really going to because this live is a long live. Somebody say fuck Bello. Yeah, you all go to Natalie Bello. Go to that picture stealer person. But anyway, that's another story that I've given before. I'm gonna stop to let my baby out so she can use the bathroom. Where am I? Somewhere in Jasper, Tennessee. I'm looking at a lake right now, and I think there's a rest area coming up. So, yes, turn your notifications on. So let me go stop for my girl, and I will talk to you all another time, guys. Bye.